Welcome to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. Note, the views on the podcast represent those of my guest and I.
Welcome to The New Chemist. We're glad you're listening. Feel free to download this podcast on Spotify and Google Podcasts. Here on The New Chemist, we discuss chemistry, which simply put is the science of change, as well as careers, community, research, and COVID-19. We're happy you're tuning in. My guest this morning is Dr. Gary May. Thanks for joining me this morning. It is good to hear from you. Just briefly, I'll inform my audience about you. Dr. Gary S. May became University of California, Davis's 7th Chancellor on August 1st, 2017. He leads the most comprehensive campus in the University of California system with 4 colleges and 6 professional schools. An accomplished scholar and engineer, Dr. May came to UC Davis after a 3-decade career at the Georgia Institute of Technology in Atlanta. He was the Dean of the Institute's College of Engineering, the largest and most diverse school of its kind in the nation. Prior to his appointment as Dean, Dr. May was the Steve W. Chaddick Chair of Georgia Tech's School of Electrical and Computer Engineering. He also served as the executive assistant to the then Georgia Tech president, Chi Wayne Clark. As chancellor of one of the world's greatest public research universities, Gary S. May leads UC Davis as it advances its mission in several key areas. In 2015, President Barack Obama honored Dr. May with the Presidential Award for Excellence in STEM Mentoring. In September 2018, Dr. May was inducted into the National Academy of Engineering, one of the highest honors in the field, for his innovations in educational programs for underrepresented groups in engineering and his contributions to semiconductor manufacturing research. In April 2020, Dr. May was elected to the American Academy of Arts and Sciences under the classification of Educational and Academic Leadership. Dr. May has won numerous honors for his research and was named Outstanding Engineer Alumnus of UC Berkeley, where he earned his master's and PhD degrees in electrical engineering and computer science. A prominent voice in higher education, Dr. May is married to Miss Michelle R. May, a software engineer with CNN. They have 2 grown daughters, Simone and Jordan. Please welcome Dr. May. Good afternoon, Dr. May. Thank you again for joining us on The New Chemist. Let's get started. Do you have any advice for those wanting to pursue the field you are currently working in?
First, David, thanks for having me. I'm glad to be the inaugural guest on your podcast. That's an honor for me.
Yes.
The advice I give for people who are interested in engineering is you have to find the part of the field, the discipline that you're passionate about. You have to really enjoy the mathematics and the science, but you have to really also find that discipline of engineering that makes you want to get out of bed every day and go to work and do something fulfilling. So that could be, for my case, it was electrical engineering, but it could be biomedical, mechanical, aerospace, whatever it is, something that tugs at your fascination and makes you curious and makes you want to solve problems.
Okay, yeah, that's very good. So what has been some of the most beneficial advice you have received to date?
Well, I've gotten much advice over my life and my career. I think, starting with my parents who, the old advice was, go do that homework, boy. And then we kind of progressed from there to, my dad used to tell me how important it was to have your own things, to be independent, to have your own opinions, to make up your own mind, and to be consistent with your views. Over the course of my career, I've gotten good advice about what jobs were good jobs, what jobs were not as attractive, how to stay successful, what networks were important to be a part of, and in my current career, I've had mentors that have guided me in how to be, statesmanlike, how to be a better public speaker. Again, what associations are important for you to continue and others that are not as important because there are many demands on your time in this role. So I had some good advice about what organizations would be useful to be a part of and what other associations it's better to delegate. So I've gotten lots of good advice on many different topics.
Okay, that's very good. That's very good. Also, how have you maintained vision and teamwork in your environment?
Well, I just think teamwork is so important. No one is talented enough to accomplish all that they want to accomplish on their own.
That's very true.
And once you're humble enough to realize that, it lets you know that you need to put a good team around you. And I've been fortunate and blessed in most of my career to have been able to work with really talented people. And the other important part of that is to let those people do their jobs and let them be self-actualized and successful on their own. And don't feel like you have to micromanage them or be involved in every single decision or every aspect of every decision. You have to hire competent people and believe in their competence, right? And because whatever they do that's positive is going to reflect on you in a positive way anyway. So let them go do that. You need to stay aware of what's going on, but you don't have to be involved in every intricacy of every decision.
Yeah, I agree. So, Dr. May, it's quite plain and clear that you have been successful as a pioneer in the field. So, how have you been so successful? What has complemented the most to your success?
David, I always say there's three aspects of anyone's success.
Okay.
One is, obviously some talent. You have to have some innate ability. The other is you have to work hard. You have to have a work ethic. You have to try to use that ability to accomplish something. And then the third aspect is the one that's the least in your control. Is you could call it luck. You could call it, serendipity. You could call it being blessed, but being in the right place at the right time is also a big part. And that's the part that a lot of really successful people don't want to admit, because no one likes to say I got here because I'm lucky, right? But the truth is, you could get hit by a bus, right, the next day. So there is some aspect of your success that really you had no responsibility for, and you have to be humble enough to admit that.
That's true. Humility is very important. So amidst all of your responsibilities and accomplishments, how do you maintain a balanced life?
Well, I think it kind of goes back to my upbringing and trying to be grounded. But I'd have to say, a big part of my balance and well-roundedness is my family. My wife is a strong support system for me and my kids and my extended family, my mom and my sister and others. And family is a really important part of my life. And I try to make sure that I keep those folks that are supporting me happy and supported as well. And I always say that, in a career, you're juggling a lot of balls. And some of those balls are rubber, and if you drop it, it'll bounce back up. Some of those balls are glass, and if you drop it, it'll break. So you have to make sure that you're taking care of the important balls, if you will, that are helping to support you and help you be well-rounded.
Okay, so make sure you have your priorities straight. So in terms of your ideas and policies, what have been some of your most effective and impactful ideas to date?
Well, I'd have to let others judge how effective or impactful my ideas are.
That's true.
Some things I'm proud of I can talk about. I mean, in my research career, early on, we made some really fundamental contributions to how integrated circuits are manufactured and the use of AI in those processes, which garnered a lot of positive attention for me early in my career. And sort of in parallel with my research, I've also always been interested in broadening participation in STEM fields for underrepresented students. And I think I've made some real good contributions in that area as well, which led to, eventually a presidential award a few years ago. And I think as an academic leader, I've had some contributions that I'm proud of in terms of having programs ranked very highly, producing many successful and talented graduates, raising lots of funds, whether it be philanthropy or research awards. So a lot of ideas contributed to those successful outcomes in those areas of my life.
I agree, and even the SURE program at Georgia Tech, which was very, very, very effective and instrumental, and I even benefited from that program as well. Yeah, so I'm grateful for it. How have you sought or found the right environment for you to thrive scientifically and intellectually? How did you find it? Or how are you seeking it?
Well, I think I always look for an environment that allows me to be my complete self. So I certainly have some intellectual challenges that I like to pursue. So you want to find a place where you can do your work and do your scholarship, but you also want to find an environment that allows you to be to relax and be yourself socially, to fulfill whatever kind of social justice imperatives you have. So allows you to work on things you think are the right thing to do, and allows you to be your own sort of authentic self, right? And so I thrive in environments where I don't feel like I have to pretend to be other than what I am. And sometimes you have to force the environment to accept that. As I've grown older, I've become much more comfortable in my skin, and I don't sort of look for an environment. I just sort of bend the environment to my will. But but it's harder to do that when you're younger and still kind of figuring things out.
Yeah, that's good. That's very good advice. Be your authentic self. Don't put on a mask.
It's much healthier to be your authentic. It's easy for one. I always tell people, the only person I'm good at being is me, so I shouldn't try to be anybody else. It's mentally much healthier and allows you to be much more effective, I think.
Yeah, it's true, because at the end of the day, you are responsible for you, and the best person you can be is yourself. Yeah,
that's right.
Yeah. So how have you been adaptive and creative? What specific ways can you come to mind immediately? What specific ways have you been adaptive or creative in the field of science?
Well, I think what I like to do is look for analogies. And what I mean by that is if I see something in the natural world, I try to adapt that to something that I'm working on scientifically. So I mentioned the AI, the semiconductor manufacturing work that we did. I was kind of fascinated early in my career with neural networks and how the brain works and all those sorts of things. And I tried to see if there are ways that you could use some of those approaches in how manufacturing could be done more efficiently, and had some success with that. So I think the overall broader answer to the question is my creativity, I think, is stimulated by sort of observing my environment and drawing connections between what I observe in the environment and what I'm working on at the moment. So, and then also listening to people, listening to smart people, reading smart people's work, and trying to figure out if I could use what other people have already figured out.
That's very good. Very good. Also, Chancellor May, another question I have is, how do you maintain view of the bigger picture in your career and in your life in general? When you've encountered challenges or obstacles, or how do you maintain view of the bigger picture?
Well, part of it is going back to the humility that I mentioned earlier. Just, I'm a spiritual person. I do pray and go to church and those sorts of things. And what it does is gives me some sense of things that are greater than myself. And so when I am faced with adversity, I think that, this is not something too big. I'm put here for a reason. This can't be too big for me to handle it. And two, adversity builds your character. Everyone's going to face it. You got to learn from it. It's like in business, they talk about fast failure. You fail fast, but you learn from it. You don't repeat it. So you don't, although adversity doesn't always feel good, often doesn't feel good when you're going through it. When you reflect on it, going back, you try to figure out what you can learn from that experience and how you can apply it going forward.
Yeah, that's very true. One of the things I've heard about is, reflecting on your actions and not just going about doing. As well, you've made a lot of impact in the field of education, a lot of impact. So specifically to those who want to make a similar impact in that specific field, what advice would you give to those, like especially those who are pursuing careers in academia, or as professors or deans or administrators? What advice would you give them specifically?
Well, I think in academic leadership, we're going to start there. The important thing is to be able to find fulfillment in other people's success, right? So, early in my career, it's much more about being an individual contributor and, establishing a track record and getting recognition and award, etc. But in leadership, that stuff is not as important anymore. It's a nice thing if I get an award, but really it's much nicer if I provide an environment here at UC Davis where our students or our faculty or our community, people in our community can be successful. So you have to kind of switch gears on your sense of what makes you, what charges you up. And so I couldn't be happier than I am when I see someone here get a big award or do something that's notable because we provided an environment that allowed them to be successful, whether that be laboratory space or funding or some sort of enrichment program or encouragement in that way. And that's where I get fulfillment now.
Okay. Wow, that's good. Yeah, I agree. It's the idea in which you move beyond focusing on yourself and trying to help other people as well, develop themselves. So what have been your long-standing what have been your long-standing interests? The overarching theme, if you had to sum it up in short, what would be your long-standing interests in the field of science? If you had to sum it up in short.
Oh, wow, that's hard to do it in short. I think, I was a kid. I loved, I had a chemistry set. I had erector sets and Legos and all those sorts of things that kind of sparked my interest in science and engineering. I've always wanted to figure out how do things work and how can I make them work better, if you have to sum it up in a short, pithy sentence.
Okay.
And that includes, people. I try to figure out what motivates people, what helps them in their own pursuits, and how can I assist them in achieving those pursuits.
Now, as well, you mentioned how you chose electrical engineering as a field to major in.
Yeah.
To be more specific, why did you choose that field? What led you to choose that? What made it click? What did it click with you, or what made you choose that?
Well,
Or encourage you to choose it?
It was a path, I guess, that I was on because I had been in programs. First of all, you take these various aptitude tests as a kid, and they tell you you're good in this, you're good in that. So I was good in math and science. They said engineering would be a possible career for me. I did a program in high school called Develop Engineering Students, which is a summer program that was sponsored by McDonnell Douglas in St. Louis, my hometown, which is now Boeing. But anyway, I did that program and got a chance to see what engineers did in their day-to-day operations, and got some mentoring for the engineers there, which led me to select that career. And now the specific discipline of electrical versus some other engineering discipline was much more serendipitous than you might think. I mentioned I had a chemistry set. I thought about chemical engineering, thought about mechanical. I had done these Heathkit radios as a kid, where you actually put together the coils and antennas and various pieces and power sources to make a real radio. So that was the interest in electronics. But I feel like I could have done any discipline in engineering and had some fulfillment or success. I just decided to just pick electrical kind of more on a whim than anything else, but it worked out okay for me.
Yeah, I would say so too. Also, I remember reading about you doing research in semiconductors.
Mm-hmm.
So why did you choose semiconductors to do your research in?
So this is going to sound funny, but when I was taking on my EE classes as an undergrad, the ones that were most challenging for me were the integrated circuit and semiconductor physics classes. And so I gravitated toward not the ones that were easier for me, but the ones that were challenging. And that's where I wanted to meet that challenge. That's where I ended up in semiconductors.
Okay. Wow. That's very good. It's very interesting. Also, Chancellor May, I would ask this last question. Amidst all of the things that are transpiring in the world today, what keeps you going? What keeps you encouraged? What keeps you optimistic?
Well, I mentioned being a spiritual person, so I have a firm commitment in trying to make things better. That helps me keep going. I want to build a better world for my family and for my broader community. I always say I have 3 things I want to do every day: learn something, help somebody, and make the world a better place. So I try to keep that going every day. And I am an optimist, so I do think we can make things better. Days, times like this, it's hard to see that because there's so much negative going on. But I am encouraged by, some of the small things I see. People starting to, really focus on social justice more than I've seen in my lifetime. I find that encouraging. I don't think, obviously we have a long way to go, but so you look for little things that make you feel more optimistic, and that keeps me going.
Okay, that's very good. Thank you, Dr. May, for your time. I really appreciate having you on this podcast.
My pleasure, David. Thanks for having me. Good luck with the podcast.
Yes, sir.
I am very grateful for the excellent role model leader and trailblazer I have had the opportunity to interact with, receive advice from and work with at points. Dr. Robert Langer, MIT Institute professor and the co-founder of Moderna. In a celebration of the work he has done and the accomplishments he has made in drug delivery, I was able to find a list of some of his citations, namely 1,561 of them. So if you want to find the citations which we will discuss, you can use Google Scholar, compose a list of his citations where he is listed as an author, arrange them by years, and then using the theme you can find the papers relevant to the themes which will be discussed in this episode. So here is the beginning of the episode. This episode will discuss his citations based off of ranges by the hundred and years in ascending order. With the use of software tools, Google Scholar and other resources, this audio review was composed. Episode title, Ode to 1,561 Citations References, 1 to 100. The references provided cover a wide range of research conducted by Robert Langer in the field of drug delivery and related areas during the 1970s and 1980s. While these studies are several decades old, they have had a profound impact on the field of drug delivery, and many of the principles and technologies developed during that time continue to be relevant today. Here are some implications and contributions of these references to drug delivery today. 1. Enzymatic regeneration of ATP, 1974. 1976. The study of enzymatic processes for regenerating ATP has implications for the development of drug delivery systems that rely on energy sources, such as implantable drug pumps or controlled release systems. Understanding the kinetics and thermodynamics of these processes can inform the design of more efficient and long-lasting drug delivery devices. 2. pH dependence of assays. 1976. Knowledge of pH-dependent assays is important for drug formulation and development, as it helps in optimizing drug stability and release under various physiological conditions. This is particularly relevant for oral drug delivery systems, where drugs may encounter different pH levels in the gastrointestinal tract. 3. Mast cells and tumor angiogenesis. 1976. Understanding the role of mast cells in angiogenesis can have implications for the development of targeted therapies to inhibit tumor growth by controlling angiogenesis. Drug delivery systems can be designed to deliver anti-angiogenic agents directly to tumor sites. 4. Polymers for sustained release. 1976. Langer's work on polymers for sustained release of proteins and macromolecules laid the foundation for modern drug delivery systems. Today, biodegradable and non-biodegradable polymer-based drug delivery systems are widely used for controlled release of drugs and biologics. 5. Isolation of a cartilage factor. 1976. This research has implications for the development of drugs or factors that can inhibit tumor neovascularization. Drug delivery systems can be employed to deliver these factors directly to the target tissue or tumor site. 6. Continuous long-term intra-arterial infusion. 1978. This work is relevant to the development of continuous drug infusion systems used in various medical applications, including cancer therapy and pain management. 7. Controlled release of macromolecules from polymers. 1980. Langer's review on controlled release from polymers is a seminal work in the field of drug delivery. It highlights the importance of sustained drug release for improving therapeutic outcomes and reducing side effects. 8. Zero-order release kinetics. 1980. Achieving zero-order release kinetics from drug delivery systems is a critical concept that continues to be explored and applied in the design of controlled release systems for various drugs and biologics. 9. Implantable drug delivery systems. 1981. The development of implantable drug delivery systems, discussed in several references, has paved the way for long-term drug delivery solutions, including subcutaneous implants and drug-eluting devices used today. 10 microspheres for controlled drug delivery. 1984. The use of polymeric microspheres for controlled drug delivery has become a well-established approach in the field of drug delivery. These microspheres can be tailored to release drugs at a controlled rate, offering prolonged therapeutic effects. 11. Local controlled release of diphosphonate. 1985. The application of controlled release systems for preventing calcification of bioprosthetic heart valves is an example of how drug delivery can be used to enhance the performance and longevity of medical implants. In summary, Robert Langer's pioneering work in drug delivery has had a lasting impact on the field. Many of the principles, technologies, and concepts he developed during the 1970s and 1980s continue to be relevant and are actively applied in the design of modern drug delivery systems, with a focus on improving therapeutic efficacy and patient outcomes. References 101-200. The references provided cover a wide range of topics related to drug delivery and biomaterials. Here are some implications for drug delivery today based on the information from these references. 1. Magnetically controlled release systems. Reference 101. The use of magnetically controlled drug delivery systems could have applications in targeted drug delivery. This technology could allow for precise control over the release of drugs at specific sites within the body, potentially reducing side effects and improving therapeutic outcomes. 2. Bioerodible polyanhydrides. Reference 102. Bioerodible polymers continue to be a significant area of research for drug delivery. These polymers can be used as drug carriers, and their degradation characteristics can be tailored to control drug release over time. Today, researchers are exploring advanced formulations and applications of bioerodible polymers for various drugs. 3. Enzymatic control of anticoagulation. Reference 104. Enzymatic control of anticoagulation remains a relevant topic in medical device development, especially for devices like artificial hearts and extracorporeal circulation systems. Techniques for controlling anticoagulation enzymatically can improve the safety and performance of these devices. 4. Heparin research. References 105, 130. Heparin and related compounds continue to be essential in anticoagulation and other medical applications. Research on heparin structure and activity is crucial for developing safer and more effective anticoagulation therapies. 5. Local controlled release for heart valve calcification. Reference 106. Localized drug delivery to prevent calcification in bioprosthetic heart valves remains an important area of study. The development of controlled release systems for this purpose could improve the longevity and performance of heart valve implants. 6. Enzymatic treatment for neonatal jaundice. References 107, 124. Enzymatic treatment for neonatal jaundice is an example of how immobilized enzyme reactors can be used therapeutically. Such systems may continue to find applications in neonatal care and other medical fields. 7. Controlled release of macromolecules. Reference 108. Controlled release of macromolecules is still a vital area of research, especially in the context of biopharmaceuticals and gene therapies. Developing systems that can provide sustained and controlled release of these large molecules is critical for their clinical success. 8. Biodegradable polyanhydrides. References 111, 167. Biodegradable polymers, including polyanhydrides, are widely used in drug delivery systems. Their biocompatibility and controlled degradation properties make them valuable for delivering a variety of drugs, including peptides and proteins. 9. Polymeric controlled drug delivery. Reference 183. Polymeric controlled drug delivery systems continue to evolve with advancements in polymer science and nanotechnology. These systems offer precise control over drug release kinetics and can be tailored to various therapeutic applications. 10. Ultrasound enhanced polymer degradation. Reference 197. The use of ultrasound to enhance polymer degradation and drug release is an area of ongoing research. This technology could lead to innovative approaches for on-demand drug delivery. 11. Immobilized enzyme reactors. References 107, 124, 155. Immobilized enzyme reactors have a wide range of applications, including detoxification and drug synthesis. These systems are valuable in biotechnology and bioprocessing. 12. Biocompatible materials. References 175, 200. Biocompatible materials, such as bioabsorbable polymers, are essential for tissue engineering and regenerative medicine. They enable the development of implants and drug delivery systems that interact safely with biological systems. In summary, the research and insights presented in these references from the 1980s have paved the way for numerous advancements in drug delivery and biomaterials. Today, researchers continue to build on this foundation, developing innovative drug delivery technologies with the potential to improve patient outcomes and revolutionize the field of medicine. References 201 to 300. The references provided cover various aspects of drug delivery and related research from the late 1980s to the early 1990s. Here are some implications and key findings from these references. 1. Bilirubin detoxification. Reference 201 discusses the simulation of bilirubin detoxification in newborns using an extracorporeal bilirubin oxidase reactor. This research likely contributes to the development of medical devices or systems for treating newborns with jaundice, improving their health outcomes. 2. Heparinase immobilization. Reference 202 discusses heparinase immobilization, which could have implications in the development of improved heparinase-based therapies for patients with blood clotting disorders. 3. Transport rates of proteins. Reference 203 explores the transport rates of proteins in porous materials with known microgeometry. This research may be relevant for designing drug delivery systems with controlled release rates and improved drug distribution within tissues. 4. Controlled release of dopamine. References 204 and 205 describe the controlled release of dopamine from polymeric brain implants. This research could have implications for the treatment of neurological disorders such as Parkinson's disease through sustained drug delivery. 5. Poly-anhydride microsphere morphology. Reference 206 discusses the morphology of poly-anhydride microsphere delivery systems. This research may contribute to the design of drug delivery systems with specific release properties. 6. Hydrolytically degradable polymers. Reference 207 discusses hydrolytically degradable amino acid containing polymers. Such polymers may find applications in drug delivery systems designed to degrade over time, releasing drugs gradually. 7. Microencapsulated liposomes. Reference 208 explores microencapsulated liposomes for enzymatically controlled pulsatile release of biologically active substances. This technology could have applications in drug delivery systems requiring precise control over drug release. 8. Inhibitor of neovascularization. Reference 209 identifies an inhibitor of neovascularization from cartilage. This discovery may have implications in anticancer and anti-angiogenesis therapies. 9. Medical reactors. Reference 210 discusses medical reactors, which might be relevant for the development of medical devices and systems for drug delivery and other applications. 10. Biocompatibility of polymeric materials. References 214 and 215 delve into toxicology and biocompatibility considerations in the evaluation of polymeric materials for biomedical applications. This research is crucial for ensuring the safety of medical devices and drug delivery systems. 11. Polyanhydrides as drug delivery systems. Reference 215 explores polyanhydrides as drug delivery systems. Polyanhydrides have been studied extensively for their potential in controlled drug release. 12. Tissue engineering. References 216, 240, and 241 discuss tissue engineering using polymeric substrates and constructs. These findings may have applications in regenerative medicine and tissue replacement therapies. 13. Ultrasound-enhanced drug delivery. References 227 and 288 mention ultrasound-enhanced drug delivery, which could lead to non-invasive methods for improving drug penetration and release. 14. Protein formulations. Reference 270 focuses on protein formulations for animal health applications, which may have implications for veterinary medicine and pharmaceuticals. 15. Insulin aggregation. Reference 284 investigates insulin aggregation and stabilization, potentially contributing to the development of more stable insulin formulations for diabetes treatment. 16. Responsive polymer systems. References 231 and 275 discuss responsive polymer systems for controlled drug delivery. Such systems can provide on-demand drug release, enhancing treatment efficacy. These references collectively demonstrate the diverse research efforts in drug delivery, biomaterials, and medical device development during the late 1980s and early 1990s, with potential applications spanning a wide range of medical fields. Researchers during this period were exploring innovative approaches to drug delivery and biocompatible materials, laying the foundation for advancements in healthcare. References 301 to 400. The references provided cover a wide range of research related to drug delivery and biomaterials from the early 1990s. Here are some implications for drug delivery today based on the information from these references. 1. Polymers for controlled drug delivery. The references discuss the use of polymers as controlled drug delivery devices. Today, this concept has evolved, and researchers continue to explore new polymer-based drug delivery systems. These systems offer the advantage of precise control over drug release, reducing the frequency of administration and improving patient compliance. 2. Tissue engineering. Several references touch upon tissue engineering using biodegradable polymers. This field has seen significant advancements in recent years, with researchers working on creating functional tissues and organs. The implications for drug delivery include the potential for targeted drug delivery within engineered tissues or organs. 3. Enzymatic modification. Reference 305 mentions enzymatic modification of plasma low-density lipoproteins as a potential treatment for hypercholesterolemia. Enzyme-based therapies have continued to develop, including enzyme replacement therapies and targeted enzyme delivery systems for various diseases. 4. Microspheres for drug delivery. References 318 and 395 discuss the use of microspheres for controlled drug delivery. Today, microsphere-based drug delivery systems are extensively researched, and they offer various advantages, such as prolonged drug release and localized drug delivery. 5. Polyanhydrides. References 306, 343, and 394 mention the use of polyanhydrides for drug delivery and tissue engineering. Polyanhydrides have remained an area of interest, and they have been explored for applications like vaccine delivery and sustained drug release. 6. Electroporation for drug delivery, references 313, 330, and 331 discuss electroporation as a method to enhance drug delivery. Electroporation continues to be explored as a non-invasive technique for transdermal and intracellular drug delivery. 7. Biodegradable scaffolds, references 333, 377, 380, and 381 mention the use of biodegradable scaffolds for various applications, including liver tissue engineering and cartilage regeneration. Today, biodegradable scaffolds are used in tissue engineering and regenerative medicine to provide structural support and controlled drug delivery to aid in tissue repair. 8. Nanoparticles, although not explicitly mentioned in your references, nanoparticles have become a significant focus in drug delivery research. Nanoparticles offer a versatile platform for drug delivery due to their small size, which allows for targeted delivery and controlled release. 9. Personalized medicine. Advances in drug delivery have paved the way for personalized medicine. Researchers are exploring the customization of drug delivery systems to match individual patient profiles, which can improve treatment outcomes and reduce side effects. 10. Clinical translation. The research mentioned in these references laid the foundation for many drug delivery technologies that are now being clinically tested and translated into practical medical applications. The continued development of these technologies holds great promise for improving patient care. In summary, the research presented in these references has had a lasting impact on the field of drug delivery. Today, drug delivery systems are becoming increasingly sophisticated, enabling more precise and effective treatment strategies across a wide range of diseases and conditions. References 401 to 500. The references provided are from 1995 and 1996 and cover a wide range of topics related to drug delivery, biomaterials, and tissue engineering. Here are some of the implications and highlights from these references for drug delivery today. 1. Electroporation for drug delivery. Reference 402. The use of electroporation for transdermal transport of DNA antisense oligonucleotides was explored. Electroporation is still a relevant technique for enhancing drug delivery across the skin, and it has applications in gene therapy and vaccine delivery. 2. Polymeric drug delivery systems. References 463 and 490. These references discuss the development and characterization of polymeric drug delivery systems. Today, polymer-based drug delivery systems continue to be a significant area of research and development, with applications ranging from sustained drug release to targeted drug delivery. 3. Tissue engineering. References 407, 408, 422, 441, 452, 481. Several references touch on tissue engineering, including the fabrication of tissue-engineered organs and the use of biodegradable polymers. Tissue engineering has evolved significantly since then and holds promise for regenerative medicine, including drug delivery within engineered tissues. 4. Ultrasound-mediated drug delivery. Reference 404. Ultrasound-mediated transdermal protein delivery was explored. Today, ultrasound is still used as a non-invasive method to enhance drug delivery, particularly for transdermal and localized drug delivery applications. 5. Liposome-based formulations. References 409, 411. Novel liposome-based formulations for prolonged delivery of proteins and vaccines were studied. Liposomes remain essential carriers for drug delivery, and research in this area continues to develop advanced liposomal formulations. 6 biodegradable polymers. References 403, 434, 479, 498, 499. The references discuss various biodegradable polymers for drug delivery and tissue engineering applications. Biodegradable polymers are widely used today for controlled drug release and tissue regeneration. 7 Vaccine delivery. References 410, 461, 478. Some references focus on vaccine delivery and stabilization. Vaccine delivery systems continue to be a critical area of research, especially in the context of global health and emerging infectious diseases. 8 Electroporation and ultrasound for transdermal drug delivery. References 456, 457, 490. These references explore the combined use of electroporation and ultrasound for enhanced transdermal drug delivery. Such combination techniques are still being investigated for improving drug delivery across biological barriers. 9 Matrix metalloproteinases in wound healing. Reference 479. The study of matrix metalloproteinases in wound healing is relevant for the development of wound care and drug delivery systems aimed at promoting tissue repair and regeneration. 10 Polymeric controlled release vaccine delivery systems. Reference 484. Polymeric controlled release vaccine delivery systems were discussed. Today, there is ongoing research into improving vaccine delivery systems to enhance their effectiveness and stability. In summary, the references provided laid the groundwork for many areas of drug delivery and biomaterials research that are still highly relevant today. Advances in these fields have led to the development of innovative drug delivery systems and therapies for various medical applications. References 501 to 600. The references provided cover a wide range of topics related to drug delivery and tissue engineering. Here are some of the implications for drug delivery today based on these references. 1. Synthetic scaffolds in tissue engineering. Reference 501. The history of tissue engineering with synthetic scaffolds highlights the importance of designing biomaterials for tissue regeneration. Today, researchers continue to explore new synthetic materials and scaffolding techniques for drug delivery and tissue engineering applications. 2. Hepatocyte tissue engineering. Reference 502. Enhanced survival of transgenic hepatocytes is crucial for liver tissue engineering and drug metabolism studies. This research may impact the development of liver-specific drug delivery systems and by artificial organs. 3. Magnetically responsive liposomes. Reference 503. Magnetically responsive liposomes have the potential for oral drug delivery applications. This reference underscores the ongoing interest in innovative drug delivery methods that improve bioavailability and targeting. 4. Lyophilized compounds and pH memory. Reference 504. Understanding the pH memory of lyophilized compounds is valuable for designing sustained-release drug formulations. Today, researchers are developing advanced drug delivery systems that can modulate drug release based on physiological conditions. 5. Poly-anhydride degradation. Reference 505. Studying the in vitro degradation characteristics of poly-anhydride imides contributes to the development of biodegradable drug delivery platforms. These materials are relevant for controlled and sustained drug release. 6. Protein aggregation in polymers. Reference 506. Heterogeneity of serum albumin samples regarding solid-state aggregation has implications for sustained drug release from polymers. Researchers continue to investigate protein-polymer interactions for controlled drug delivery. 7. Polymer adsorption to microparticles. Reference 507. Understanding the adsorption of polymers to microparticles is essential for optimizing drug encapsulation and release characteristics. This knowledge informs the design of drug-loaded microcarriers. 8. Process simulation for protein production. Reference 508. Process simulation for recombinant protein production is relevant for biopharmaceuticals. Advances in this area help streamline the production of therapeutic proteins and peptids. 9. RGD peptid modified biomaterials. Reference 509. RGD peptid modified biomaterials offer interactive and resorbable properties. These materials are of interest for tissue engineering and drug delivery applications, especially for regenerative medicine. 10. Non-invasive drug release monitoring. Reference 510. Non-invasive monitoring of drug release and polymer erosion using techniques like EPR spectroscopy and NMR imaging is valuable for assessing the performance of drug delivery systems in vivo. 11. Zero-order drug release. Reference 511. Understanding zero-order release kinetics is essential for developing drug delivery devices that provide constant drug levels over time. This concept influences the design of long-acting drug delivery systems. 12. PEG-coated nanospheres. Reference 512. The development of PEG-coated nanospheres and their drug encapsulation properties has implications for nanoparticle-based drug delivery systems, which can enhance drug solubility and targeting. 13. Photo-cross-linked polymers. Reference 513. The synthesis and characterization of photo-cross-linked polymers are relevant for tissue engineering and controlled drug release. These materials provide platforms for local drug delivery. 14. Pulmonary drug delivery. Reference 514. Large porous aerosols for pulmonary drug delivery are an important area of research, impacting the treatment of respiratory diseases and systemic drug delivery through the lungs. 15. Controlled protein delivery. Reference 515. Controlled protein delivery from biodegradable microspheres is significant for applications in regenerative medicine and sustained drug release of therapeutic proteins. 16. Bioprosthetic heart valves. Reference 516. Novel approaches for constructing bioprosthetic heart valves have implications for cardiovascular drug delivery and tissue engineering of heart-related therapies. 17. Electrically conducting polymers. Reference 517. Stimulation of neurite outgrowth using electrically conducting polymers is relevant for neural drug delivery and tissue engineering of nerve-related disorders. 18. Film tension theory of phagocytosis. Reference 518. The film tension theory of phagocytosis provides insights into particle interactions with cells, which can influence the design of drug delivery carriers. 19. Surface reactive amino groups. Reference 519. Characterization of surface reactive amino groups on polymers is crucial for understanding biomaterial interactions, including drug delivery vehicle interactions with biological systems. 20. Immunogenicity of microspheres. Reference 520. Understanding the long-term immunogenicity of drug-loaded microspheres has implications for developing biodegradable drug delivery systems with minimal immune responses. These references collectively demonstrate the ongoing research efforts in drug delivery and tissue engineering, highlighting the importance of material science, controlled release strategies, and the development of innovative biomaterials for various therapeutic applications. Researchers continue to build upon this foundation to create more effective and targeted drug delivery systems. References 601 to 700. The references provided are from the late 1990s and early 2000s and cover a wide range of topics related to drug delivery and biomaterials. Here are some of the implications for drug delivery that can be drawn from these references. 1. Polymeric systems for controlled drug release. Reference 601. This paper likely discusses the development of polymers for controlled drug release. The implications include the potential for creating drug delivery systems that release medications at a controlled rate, improving patient compliance and reducing side effects. 2. Regional heparinization via simultaneous separation and reaction. Reference 602. This reference appears to relate to a novel method for regional heparinization. The implication here could be the development of improved techniques for anticoagulation during medical procedures or surgeries. 3. Cellular tissue engineering approaches. Reference 603. This reference suggests the exploration of cellular tissue engineering for medical applications. It implies the potential for creating functional tissues for transplantation or repair, including drug delivery within engineered tissues. 4. Rheological properties and microstructure of tissue-engineered cartilage. Reference 604. Understanding the rheological properties of tissue-engineered cartilage can aid in designing better drug delivery systems for joint-related conditions. 5. Transdermal photopolymerization of hydrogels. Reference 605. This reference likely discusses a method for creating hydrogel-based drug delivery systems through transdermal photopolymerization. The implication is the potential for improved transdermal drug delivery systems with precise control. 6. Transtissue photopolymerization of hydrogels. Reference 606. Similar to the previous reference, this one may discuss the photopolymerization of hydrogels for drug delivery. The implication is the development of new techniques for tissue-specific drug delivery. 7. Advances in skin electroporation. Reference 607. This reference implies advancements in skin electroporation, which can enhance transdermal drug delivery. The implications include improved drug delivery methods for various medical conditions. 8. Atomic force microscopy analysis of proteins. Reference 608. This reference suggests the use of atomic force microscopy for protein analysis. The implication is the potential for understanding and optimizing protein-based drug delivery systems. 9. Surface engineering and surface analysis of biodegradable polymers. Reference 610. This reference implies advancements in the surface engineering of biodegradable polymers. The implications include improved biodegradable drug delivery systems. 10. Tissue engineering of autologous aorta. Reference 611. This reference suggests the tissue engineering of autologous blood vessels. The implication is the potential for creating personalized drug delivery systems for cardiovascular diseases. 11. Poly, a eusic acid dimer anhydride. Reference 612. This reference likely discusses a specific polymer. The implication depends on its context but could relate to the development of new materials for drug delivery. 12. Protein stability in controlled release systems. Reference 613. Understanding protein stability in drug delivery systems is critical for biopharmaceuticals. The implication is the potential for more effective protein-based drug delivery. 13. Transdermal monitoring of glucose. Reference 614. Monitoring glucose levels through transdermal methods can have implications for diabetes management and continuous drug delivery. 14. Biodegradable photo-cross-linked poly-ester networks. Reference 615. This reference implies the development of biodegradable photo-cross-linked polymers for various applications, including drug delivery. 15. Tissue engineering. Reference 616. The reference to tissue engineering suggests the potential for creating tissues with integrated drug delivery capabilities for regenerative medicine. 16. Ultrasound-induced transdermal drug delivery. Reference 617. Ultrasound-assisted drug delivery methods can enhance drug penetration through the skin, leading to more efficient transdermal drug delivery. 17 microchips as controlled release devices. Reference 623. Microchip technology can enable precise control over drug release, potentially leading to advanced implantable drug delivery systems. 18 non-invasive drug delivery using low-frequency sonophoreses. References 631, 632, 633, 634. Low-frequency sonophoreses can be a non-invasive method for drug delivery. The implications include painless and efficient drug delivery techniques. 19 pH-responsive polymer microspheres. Reference 665. pH-responsive drug delivery systems can release drugs in response to changes in pH levels within the body, which can be useful for targeted drug delivery. 20 shape memory polymers. Reference 687. Shape memory polymers can be designed for specific drug delivery applications, where the polymer changes shape in response to external stimuli, releasing drugs as needed. These references collectively highlight the significant advancements and potential applications of various drug delivery technologies and biomaterials during the late 1990s and early 2000s. These developments have likely had a lasting impact on the field of drug delivery, contributing to more efficient and patient-friendly drug delivery systems. References 701 to 800. The references provided cover a wide range of topics related to drug delivery and biomaterials. Here are some of the main implications and contributions of these references to drug delivery today. 1. Ultrasound-enhanced transdermal drug delivery. Reference 701. This reference explores the use of low-frequency ultrasound to enhance transdermal drug delivery. The study's findings have implications for improving the non-invasive delivery of drugs through the skin, which is a valuable approach for many therapeutic applications. 2. Skin permeability prediction. Reference 702. The research in this reference focuses on predicting skin permeabilities of various drugs, considering hydration effects. Such predictive models can aid in the development of transdermal drug delivery systems, helping to optimize drug formulations for skin penetration. 3. Neural stem cell seeding. Reference 703. This reference discusses seeding neural stem cells on polymer scaffolds. While not directly related to drug delivery, the use of scaffolds for cell-based therapies has implications for tissue engineering and regenerative medicine, including the potential for drug delivery in tissue-engineered constructs. 4. Reversible switching of surfaces. Reference 704. This reference explores reversible surface modifications, which can have applications in drug delivery, especially in the controlled release of drugs from surfaces or implants. The ability to switch surfaces on and off has implications for precise drug release control. 5. Microemulsion enhancers. Reference 705. The development of novel microemulsion enhancers for transdermal delivery of hydrophilic and hydrophobic drugs is significant. Such formulations can improve drug solubility and skin permeability, expanding the possibilities for transdermal drug delivery. 6. Low molecular weight heparins. Reference 706. Rational design of low molecular weight heparins with improved in vivo activity is relevant to anticoagulant therapy. These modified heparins may offer better pharmacokinetics and more convenient dosing regimens, potentially improving patient outcomes. 7. MEMS drug delivery devices. Reference 708. The biocompatibility and biofouling aspects of MEMS, microelectromechanical systems, drug delivery devices are crucial for their clinical viability. Ensuring that these devices are well tolerated in the body is essential for effective drug delivery. 8. Three-dimensional microfabrication. Reference 709. The ability to create three-dimensional microstructures, such as electrodeposited structures, has implications for various applications, including drug delivery devices. Precise microfabrication can enable the design of more efficient drug delivery systems. 9. Two-photon fluorescence microscopy. References 710 and 728. Visualization techniques like two-photon fluorescence microscopy can be used to study drug diffusion pathways in tissues and across biological barriers, aiding in the design of targeted drug delivery systems. 10. Sustained drug release from microspheres. Reference 711. Decreasing the burst effect of drug release from PLGA microspheres is crucial for achieving sustained and controlled drug delivery. This reference explores strategies to improve the release profile of drugs from microspheres. 11. Gene delivery. References 715 and 716. The references discuss the synthesis and screening of degradable cationic polymers for gene delivery. Advances in gene delivery technologies are essential for various therapeutic applications, including gene therapy and personalized medicine. 12. Cardiac tissue engineering. References 717 and 751. Tissue engineering approaches for cardiac tissue and myocardial constructs have implications for drug testing and cardiac drug delivery. These models can be used to assess the effects of drugs on cardiac tissue in vitro. 13. Biodegradable polymer scaffolds. Reference 718. Understanding the degradation characteristics of biodegradable polymers, such as polyglycerol sabacate, is vital for the design of drug delivery systems based on these materials. It influences drug release kinetics and tissue integration. 14. Inhaled insulin. Reference 720. The development of inhaled insulin products has implications for improving patient compliance and convenience in diabetes management. This reference discusses recent advances in this field. 15. Nanocomposites for gene delivery. Reference 721. Polyhistidine PEG. DNA nanocomposites for gene delivery offer potential solutions for efficient gene therapy. These materials may enhance gene delivery while minimizing cytotoxicity. 16. Human embryonic stem cells on scaffolds. References 722 and 761. The use of scaffolds for human embryonic stem cell differentiation has broader implications for tissue engineering and regenerative medicine. It may eventually lead to the development of drug delivery systems incorporated into tissue-engineered constructs. 17. Microchip drug delivery. References 723 and 795. The development of microchip-based drug delivery devices allows for precise control over drug release kinetics. Such devices can be used for prolonged drug delivery in various therapeutic applications. 18. pH-triggered drug release. References 724 and 774. pH-triggered drug release systems are valuable for site-specific drug delivery. These references explore the design and performance of such systems, which can be applied to various drug delivery platforms. 19. Soft lithography and microfluidics. References 740 and 741. Soft lithography and microfluidics techniques enable precise patterning and manipulation of materials. These methods have applications in the fabrication of drug delivery devices and controlled release systems. These references collectively demonstrate the multidisciplinary nature of drug delivery research, spanning areas such as materials science, tissue engineering, microfabrication, and drug formulation. The findings and innovations from these studies continue to influence drug delivery strategies and technologies today. References 801 to 900. The provided list of references includes a wide range of research articles and reviews that span various aspects of drug delivery and related topics. While it's not feasible to provide a detailed analysis of each reference, I can offer some general implications and key takeaways for drug delivery research based on the information available in the references. 1. Diverse drug delivery mechanisms. Moss and Langer's work on drug delivery mechanisms, reference 801, highlights the importance of understanding the various methods and mechanisms involved in drug delivery. Today, researchers continue to explore and develop diverse drug delivery systems, including nanoparticles, microspheres, hydrogels, and more. 2. Biocompatibility and inflammatory responses. References 802, 803, and 804 emphasize the significance of studying the biocompatibility and potential inflammatory responses of drug delivery materials. Ensuring that drug delivery systems are well tolerated by the body remains a key concern in research today. 3. Targeted gene delivery. Reference 803 discusses the development of hierarchically self-assembling polymers for targeted gene delivery. Targeted delivery of therapeutic genes is an active area of research, aiming to improve the specificity and efficacy of gene therapies. 4. Nerve regeneration and tissue engineering. References 804, 818, and 826 delve into nerve guide materials, cardiac tissue engineering, and bone bioreactors, respectively. These studies reflect the growing interest in using drug delivery approaches to promote tissue regeneration and repair, which is particularly relevant in the fields of neurology, cardiology, and orthopedics. 5. Polymeric gene delivery. Reference 805 highlights structure/property studies of polymeric gene delivery. Developing safe and efficient gene delivery vectors remains a crucial focus in gene therapy research. 6. Smart materials. Reference 814 discusses smart materials with dynamically controlled surfaces. The development of responsive drug delivery systems that can release drugs in a controlled and triggered manner is an ongoing area of research. 7. Microfluidics and tissue engineering. References 848, 850, 851, and 883 emphasize the integration of microfluidics and tissue engineering. Microscale technologies and microfabrication techniques have become instrumental in creating complex tissue models and drug delivery systems. 8. Nanoparticles in drug delivery. References 869, 880, 883, and 897 highlight the use of nanoparticles in drug delivery. Nanotechnology has opened up new possibilities for targeted drug delivery and imaging, revolutionizing the field. 9. Aptamers for targeted drug delivery. References 869, 899, and 900 discuss the use of aptamers in targeted drug delivery. Aptamers, which are short DNA or RNA molecules, show promise in guiding drugs to specific targets in the body. 10. Biodegradable polymers. References 852, 868, and 874 emphasize the use of biodegradable polymers in tissue engineering and drug delivery. Biodegradable materials minimize long-term adverse effects and are crucial for controlled drug release. 11. Tissue-specific drug delivery. Reference 865 discusses the application of micro and nano-electromechanical devices for drug delivery. The ability to precisely target and release drugs in specific tissues or cells is a key focus. 12. Controlled release. References 867, 874, and 876 discuss the modulation of drug release within scaffolds and hydrogels. Achieving controlled and sustained drug release profiles remains a central goal. 13. Regulatory considerations. The references touch upon the complexity of regulatory approval for combination products, reference 854, and the need for understanding the safety and efficacy of drug delivery systems, reference 859. 14. Clinical translation. Many of these references provide insights into translational aspects, bridging the gap between fundamental research and clinical applications. In summary, drug delivery research today encompasses a wide range of strategies, including advanced materials, nanotechnology, smart delivery systems, and tissue engineering, all aimed at improving the precision, safety, and effectiveness of drug delivery for various medical applications. Researchers are also addressing issues related to biocompatibility, inflammatory responses, and regulatory considerations to advance the field further. References 901 to 1000. The provided list of references represents a wide range of research in the field of drug delivery and related topics, authored or co-authored by Robert Langer and his colleagues. While the references cover various aspects of drug delivery and biomaterials, here are some of the main implications for drug delivery research based on these references. 1. Nanoparticulate drug delivery. References such as 901, 904, and 911 highlight the use of nanoparticles for delivering drugs, genes, and therapeutic agents. This approach allows for targeted and controlled release, which can enhance drug efficacy while minimizing side effects. 2. Tissue engineering. References like 902, 915, and 964 demonstrate the importance of biomaterials and tissue engineering in drug delivery. Scaffold materials can be designed to support tissue regeneration and controlled drug release, which is crucial for regenerative medicine. 3. Neuroprotection. Reference 903 discusses neuroprotection using drug-loaded microspheres. This has implications for the treatment of neurodegenerative diseases and conditions. 4. Gene silencing therapies. Reference 906 mentions gene silencing therapies. This field has the potential to revolutionize the treatment of genetic disorders and other diseases at the genetic level. 5. Cancer therapy. References 905, 912, and 941 emphasize the use of targeted nanoparticles for cancer therapy. This approach can improve the specificity of cancer treatments while reducing damage to healthy tissues. 6. Microfabrication and microfluidics. References 907, 908, and 950 discuss microfabrication techniques and microfluidics, which enable precise control over drug delivery systems and allow for high-throughput screening of drug formulations. 7. Stem cell research. References 909 and 915 showcase the use of hydrogels and stem cells for tissue regeneration. This research has implications for drug delivery within regenerative medicine contexts. 8. Peritoneal adhesion prevention. Reference 910 addresses the prevention of peritoneal adhesions using a gel-based approach, which could improve surgical outcomes and reduce complications. 9. Transdermal drug delivery. References 965 and 966 discuss transdermal drug delivery, which has the potential to provide a painless and convenient route for drug administration. 10. Nanotechnology. References 954, 955, and 954 emphasize the role of nanotechnology in drug delivery. This includes the development of nanoparticles, nanoscale materials, and nanofabrication techniques to improve drug delivery systems. 11. Safety and quality control. references 974, 978, and 980 touch on safety and quality control in drug delivery. Ensuring the safety and purity of drug delivery systems is critical for clinical applications. 12 clinical implications and adverse events, references 958, 961, 974, 975, 976 discuss real-world clinical implications, including adverse events associated with contaminated heparin. Such incidents highlight the importance of stringent quality control in drug manufacturing. These references collectively underscore the interdisciplinary nature of drug delivery research, where materials science, nanotechnology, biology, and clinical medicine intersect to develop innovative approaches for delivering drugs and therapies. The implications range from more effective cancer treatments to regenerative medicine breakthroughs and improved patient safety. References 1001 to 1100. The references provided cover a wide range of topics in drug delivery research, including nanoparticles, tissue engineering, gene delivery, and more. Here are some of the main implications for drug delivery research today based on these references. 1. Nanoparticle-based drug delivery. Several references discuss the development of lipid polymer hybrid nanoparticles. For example, reference 1001. These nanoparticles provide a robust platform for drug delivery. The implication here is that such nanoparticles can be tailored for specific drugs and applications, offering precise and controlled delivery of therapeutic agents, potentially reducing side effects and improving treatment outcomes. 2. RNA therapeutics. References like 1002 discuss therapeutic RNA interference, RNA, targeting specific genes. This approach has the potential to revolutionize the treatment of various diseases, including cardiovascular conditions and cancer. The development of safe and effective delivery systems for RNA molecules is a significant focus of current research. 3. Tissue engineering. References such as 1003 and 1008 highlight the use of innovative materials and scaffold designs for tissue engineering. The implication is that these technologies could lead to advancements in regenerative medicine, enabling the repair or replacement of damaged tissues and organs. 4. Protein adhesion. Reference 1004 discusses the study of protein adhesion and adsorption to microarrayed polymers. This research can have applications in drug delivery by improving the surface properties of drug carriers, allowing for better interactions with biological systems. 5. Small interfering RNA, siRNA, delivery. References 1005 and 1025 explore the delivery of siRNA to inhibit specific cellular processes. The development of safe and efficient siRNA delivery systems holds promise for treating a wide range of diseases by targeting specific genes or pathways. 6. Pharmacodynamics assessment. Reference 1006 addresses the assessment of siRNA pharmacodynamics in a living organism. This is crucial for understanding how drug candidates behave in vivo and optimizing their delivery for therapeutic effect. 7. Cancer therapy. Reference 1007 discusses nanoparticle delivery of suicide DNA for ovarian cancer therapy. Cancer treatment remains a significant focus of drug delivery research, aiming to improve the specificity and efficacy of therapies while minimizing side effects. 8. Polymeric materials for gene delivery. Reference 1009 discusses the synthesis of polyamino esters for gene delivery. Innovations in polymeric materials and gene delivery vectors are essential for improving gene therapy approaches. 9. Nanotechnology impact. References 1010 and 1064 discuss the impact of nanotechnology on drug delivery. Nanotechnology plays a vital role in the design of drug delivery systems, enabling precise control over drug release and targeting. 10 Barrier knockdown. Reference 1011 discusses advances in siRNA delivery and knocking down barriers. Overcoming biological barriers is a fundamental challenge in drug delivery, and innovative strategies are being developed to enhance drug penetration. 11 Microfluidic devices. Reference 1012 describes the use of microfluidic devices for controlled drug delivery. Microfluidics offers precise control over particle formation and drug release, allowing for tailored drug delivery systems. 12 Stem cell-based therapies. References like 1038 and 1048 highlight the importance of stem cell-based therapies and their delivery. Stem cell research combined with advanced delivery techniques holds promise for regenerative medicine and personalized medicine approaches. 13 Biomaterials and hydrogels. References 1041 and 1046 discuss the use of biomaterials, hydrogels, and 3D scaffolds. These materials play a critical role in tissue engineering, providing a suitable environment for cells and drugs. 14 Imaging and monitoring. References like 1039 and 1061 discuss the use of imaging techniques for monitoring drug delivery and cellular responses. Real-time monitoring and feedback systems are essential for personalized medicine approaches. 15 Nanoparticle functionalization. Reference 1021 discusses the formulation and preparation of functionalized nanoparticles for targeted drug delivery. Functionalization strategies enable the design of nanoparticles that can specifically target disease sites. Overall, these references collectively highlight the ongoing efforts to develop innovative drug delivery strategies, materials, and technologies that can lead to more effective and targeted treatments for a wide range of diseases. The field of drug delivery continues to evolve, offering exciting possibilities for improving patient care and outcomes. References 1101 to 1200. The provided list of references spans a wide range of topics related to drug delivery, biomaterials, and nanotechnology. Here are some of the main implications for drug delivery today that can be drawn from these references. 1. Biodegradable elastomers. Reference 1101. The use of biodegradable elastomers like polyglycerol sabacate can offer controlled drug release over time. This approach can be beneficial for sustained drug delivery, reducing the need for frequent administrations. 2. Core shell nanoparticles. Reference 1102. High throughput synthesis of core shell nanoparticles allows for the development of diverse nanocarriers for drug delivery. This approach enables the encapsulation of various therapeutic agents, improving drug stability and delivery efficiency. 3. Microfluidics for nanoparticle synthesis. Reference 1103. Microfluidic systems can provide precise control over nanoparticle size and composition, enhancing drug delivery system customization. This technology can be employed to create nanoparticles with tunable properties. 4. Nanotechnology in uro-oncology. Reference 1104. Nanotechnology plays a role in the field of interventional techniques, which can be applied to targeted drug delivery for urological cancers. This highlights the potential for personalized therapies in oncology. 5. Stem cell-based microvascular grafts. Reference 1105. Human embryonic stem cell-based microvascular grafts hold promise for cardiac tissue preservation and regeneration after myocardial infarction. This research suggests the potential for using stem cells in drug delivery and tissue engineering. 6 fouling-resistant surfaces. Reference 1106. High-throughput methods for discovering fouling-resistant surfaces can be beneficial for developing implantable drug delivery devices. Reduced fouling can lead to longer device lifetimes and improved drug release kinetics. 7 real-time detection of reactive oxygen species. Reference 1107. Real-time detection of biomaterial-induced reactive oxygen species can inform the design of drug delivery systems, ensuring they do not trigger harmful immune responses. 8 ultrasound-mediated transdermal drug delivery. References 1108 and 1112. Ultrasound-mediated drug delivery methods have the potential to enhance transdermal drug delivery. This technology can improve drug penetration through the skin, expanding options for non-invasive drug administration. 9 enhanced transdermal delivery of nanoparticles. Reference 1109. Using ultrasound and enhancers like sodium lauryl sulfate can increase the transdermal delivery of nanoparticles. This could be significant for topical drug delivery applications. 10 injectable thiolacrylate hydrogel. Reference 1110. Injectable hydrogels for sustained drug release, like thiolacrylate polyethylene glycol hydrogels, offer potential for long-acting drug formulations and localized drug delivery. 11 engineering patent co-cultures. Reference 1111. Engineering systems for generating patent co-cultures can help control cell-cell interactions. This has applications in tissue engineering and drug testing, allowing the study of complex cell responses. 12 responsive microgrooves. Reference 1115. Responsive microgrooves can be used to create harvestable tissue constructs. This approach holds potential for controlled drug delivery within tissue engineering scaffolds. 13 intracranial microcapsule drug delivery. Reference 1116. Intracranial microcapsules can be used for drug delivery to treat conditions like gliosarcoma. These implantable devices offer targeted drug release in difficult-to-reach locations. 14 siRNA delivery and immune system. Reference 1117. Research on siRNA delivery and its interaction with the immune system is crucial for understanding the safety and efficacy of RNA-based therapies. 15 sterilization of soft biomaterials. Reference 1118. Sterilization techniques for soft biomaterials are essential for maintaining the safety and integrity of implantable drug delivery devices. 16 polymeric gene delivery. Reference 1135. Understanding the structure-activity relationships of polymeric gene delivery systems can lead to the development of safer and more efficient gene delivery vectors. These references collectively illustrate the interdisciplinary nature of drug delivery research, highlighting innovations in materials science, nanotechnology, microfluidics, and biotechnology. The implications for drug delivery today include improved control over drug release, enhanced targeting of specific tissues, and the development of personalized therapies. These advancements hold great potential for the future of healthcare and pharmaceuticals. References 1201 to 1300. The references provided cover a wide range of topics related to drug delivery. Here are some of the main implications for drug delivery based on the information in these references. 1. Biomimetic cell-penetrating peptids, CPPs. Reference 1201. Rational design of CPPs can enhance the delivery of drugs and therapeutic molecules across cell membranes. Improved drug delivery efficiency can lead to more effective treatments with lower doses and reduced side effects. 2 microfluidic platforms for intracellular delivery. Reference 1202. Microfluidic devices offer a promising approach for intracellular drug delivery. Precise control over fluidic parameters can enable the efficient and targeted delivery of therapeutic agents to cells. 3 modular click-in emulsion nanogels. Reference 1203. Nanogels can serve as versatile drug carriers with tunable properties. Bone-targeted nanogels hold promise for localized drug delivery to treat bone-related disorders. 4 benchtop fabrication of microfluidic systems. Reference 1204. Improved fabrication techniques for microfluidic systems can enhance the development of advanced drug delivery platforms. Compatibility with various solvents is crucial for the versatility of microfluidic devices. 5 cell squeezing as a microfluidic intracellular delivery platform. Reference 1205. Cell squeezing technology offers a robust method for intracellular drug delivery. This approach can be valuable for the delivery of various therapeutic agents into cells. 6 Efficiency of siRNA delivery by lipid nanoparticles. Reference 1206. Understanding the limitations of siRNA delivery by lipid nanoparticles is essential for optimizing RNA interference-based therapies. Addressing endocytic recycling challenges can lead to more efficient siRNA delivery. 7 Analysis and prediction of defects in polymer microarrays. Reference 1207. Quality control and optimization of drug delivery materials, such as polymer microarrays, are critical for ensuring consistent performance. Predictive models can help identify and address potential defects. 8 Historical perspective on biomaterials and biotechnology. Reference 1208. Biomaterials play a foundational role in drug delivery systems, tissue engineering, and regenerative medicine. Advances in biomaterials have significantly contributed to the field of drug delivery. 9 Multiparametric evaluation of lipid nanoparticles for siRNA delivery. Reference 1209. A comprehensive evaluation approach is essential for assessing the effectiveness of lipid nanoparticles in siRNA delivery. Multiparametric analyses can provide valuable insights into nanoparticle performance. 10 Enhanced DNA delivery to the cytoplasm. Reference 1210. Cross-linked linear polyethylenamine represents a promising approach for enhancing the delivery of DNA to the cytoplasm of target cells. These references collectively highlight the importance of developing innovative drug delivery strategies, optimizing carrier materials, and improving the efficiency and precision of drug delivery techniques. These advancements have the potential to revolutionize the field of medicine by enabling more effective and targeted therapies while minimizing side effects. References 1301 to 1400. The references provided include a wide range of research papers covering various aspects of drug delivery. Here are some of the main implications for drug delivery based on the information from these references. 1. Advancements in vaccine delivery. Reference 1301 discusses the development of a mucosal vaccine against chlamydia trachomatis. This suggests that mucosal vaccine delivery strategies are being explored as a means to generate protective immune responses against infectious diseases. 2. Single injection vaccines. Reference 1302 talks about single injection vaccines, indicating efforts to simplify vaccination regimens. Such vaccines could enhance patient compliance and improve the efficiency of vaccination programs. 3. Nanoparticle hydrogels. Reference 1303 discusses the exploitation of electrostatic interactions in polymer nanoparticle hydrogels. This suggests the use of nanoparticle-based hydrogels for controlled drug delivery, potentially improving drug release kinetics and targeting. For ultrasound-mediated drug delivery, reference 1304 introduces ultrasound-mediated gastrointestinal drug delivery. This technique may offer a non-invasive and targeted approach for drug delivery, particularly for conditions like ulcerative colitis. 5-gene silencing with dendrimers, reference 1305 mentions dendrimeric siRNA for efficient gene silencing. This implies the development of advanced nanoparticle systems for delivering genetic therapies and gene-based drugs. 6. Cell-based drug delivery and therapy, reference 1307 discusses non-genetic engineering of cells for drug delivery and cell-based therapy. This highlights the exploration of cell-based approaches for drug delivery and therapeutic applications. 7. Nanomedicines for endothelial disorders, reference 1308 discusses nanomedicines for endothelial disorders, which may have implications for the treatment of cardiovascular diseases and related conditions. 8. Hydrogels with enhanced stability, reference 1309 talks about covalent incorporation of trehalose within hydrogels for enhanced long-term stability and controlled release of biomacromolecules. This approach may improve the shelf life and efficacy of drug delivery systems. 9. Targeted nanoparticles for atherosclerosis, reference 1310 introduces HDL-mimetic PLGA nanoparticles for targeting atherosclerotic plaque macrophages. This indicates efforts to develop targeted nanoparticle-based therapies for cardiovascular diseases. 10. Responsive hydrogels, reference 1311 discusses injectable self-healing glucose-responsive hydrogels with pH-regulated mechanical properties. Such hydrogels have implications for diabetes management and responsive drug delivery. 11. Phototriggerable liposomes, reference 1312 mentions repeatable and adjustable on-demand sciatic nerve block with phototriggerable liposomes. This highlights the use of light-responsive drug delivery systems for localized pain management. 12. Environmental applications, reference 1313 discusses nanoparticles with photo-induced precipitation for the extraction of pollutants from water and soil. This research has implications for environmental remediation through drug delivery technologies. 13. Microfluidic antigen loading, reference 1314 talks about microfluidic squeezing for intracellular antigen loading in polyclonal B cells as cellular vaccines. This suggests the development of novel methods for antigen loading in immune cell-based therapies. 14. Neutrophil responses, reference 1315 explores neutrophil responses to sterile implant materials, which is important for understanding and mitigating the foreign body response to implanted drug delivery devices. 15. Gastrointestinal physiologic monitoring, reference 1316 discusses physiologic status monitoring via the gastrointestinal tract, which has implications for real-time monitoring and drug delivery applications. 16. Biomaterials and molecular movement, reference 1317 addresses the regulation of the movement of molecules by chemical materials, which is essential for designing effective drug delivery systems. These references collectively highlight the diverse and innovative approaches being explored in drug delivery, ranging from vaccines and nanoparticles to advanced hydrogels and cell-based therapies. These advancements have the potential to significantly impact the effectiveness and safety of drug delivery for various medical conditions. References: 1401 to 1500. The references provided cover a wide range of topics in drug delivery and related areas of research. Here are some of the main implications and contributions from these references. 1. Reference 1401. This reference discusses the use of synthetic microparticles conjugated with VEF165 to improve the survival of endothelial progenitor cells. This approach could have implications for regenerative medicine and tissue engineering, as it addresses the challenge of enhancing cell survival and function in therapeutic applications. 2. Reference 1402. This study focuses on the role of Ly6C, low, monocytes in immunosuppression and resistance to anti-VEF2 therapy in colorectal cancer. Understanding the mechanisms behind immunosuppression in cancer has implications for the development of more effective cancer treatments, including drug delivery strategies. 3. Reference 1403. The development of a humanized mouse model that recapitulates the fibrotic response to biomaterial implants is crucial for understanding and improving the biocompatibility of implanted medical devices and drug delivery systems. 4. Reference 1404. This reference discusses the applications of ethylene vinyl acetate copolymers, EVA, in drug delivery systems. EVA-based drug delivery systems have implications for controlled drug release and long-term therapeutic applications. 5. Reference 1406. Surface modification of membranes for retinal explants has potential implications for ocular drug delivery and treatment of retinal diseases. 6. Reference 1411. Circulating magnetic microbubbles for localized real-time control of drug delivery through ultrasonography-guided magnetic targeting and ultrasound offer a non-invasive approach to drug delivery, particularly in cancer therapy. 7. Reference 1412. The development of an oral once-weekly drug delivery system for HIV antiretroviral therapy is a significant advancement in improving patient adherence and the effectiveness of HIV treatment. 8. Reference 1415. Cellular scale probes for monitoring dopamine neurochemicals in a rodent model have potential applications in drug development and understanding neurochemical changes associated with various diseases. 9. Reference 1416. The review on smart biomaterials highlights the importance of developing advanced materials for drug delivery and tissue engineering, with implications for personalized medicine and regenerative therapies. 10. Reference 1425. The miniaturized neural system for chronic, local intracerebral drug delivery has implications for the treatment of neurological disorders and brain-related diseases. 11. Reference 1433. Advances in biomaterials for drug delivery are crucial for improving the effectiveness and safety of drug therapies, as well as for targeted drug delivery to specific tissues or cells. 12. Reference 1437. The development of bioresorbable composite polymeric implants with high mechanical strength has implications for the design of medical implants and drug delivery devices. 13. Reference 1446. Ingestible bacterial electronic systems for monitoring gastrointestinal health have potential applications in personalized medicine and the early detection of gastrointestinal diseases. 14. Reference 1451. Ingestible self-orienting systems for oral delivery of macromolecules offer a novel approach to drug delivery, with potential applications in oral immunotherapy and targeted delivery. 15. Reference 1453. Steerable microinvasive probes for localized drug delivery to deep tissue have implications for precision medicine and targeted therapies. 16. Reference 1458. The use of crystallized drug formulations to prevent implant fibrosis has significant implications for the development of long-lasting implantable drug delivery systems. 17 Reference 1459. The delivery of mRNA vaccines with heterocyclic lipids has implications for the development of next-generation vaccines and immunotherapies. 18 Reference 1467. A luminal unfolding microneedle injector for oral delivery of macromolecules opens new possibilities for oral drug administration and vaccination. 19 Reference 1468. A new approach for microfabrication of printed circuit boards with ultrafine traces could have implications for the development of miniaturized drug delivery devices and sensors. These references collectively highlight the diverse and evolving field of drug delivery, with potential applications ranging from cancer therapy and HIV treatment to neuroscience and gastrointestinal health monitoring. Advances in materials, technologies, and delivery strategies continue to shape the future of medicine and healthcare. The references provided cover a wide range of topics related to drug delivery and biomaterials. Here are some of the main implications and contributions of these references for drug delivery today. 1 Reference 1401, Ede et al. 2017. This study focuses on improving the survival of endothelial progenitor cells using synthetic microparticles conjugated with VEF165. The implication for drug delivery is the development of innovative approaches to enhance the effectiveness of cell-based therapies, which can have applications in regenerative medicine and tissue engineering. 2 Reference 1404, Schneider et al. 2017. This reference discusses the applications of ethylene vinyl acetate copolymers, EVA, in drug delivery systems. EVA is commonly used in the fabrication of controlled-release drug delivery devices. The implication here is the continued exploration and optimization of EVA-based drug delivery systems for various therapeutic agents. 3 Reference 1411, Chertok and Langer, 2018. This study introduces the concept of circulating magnetic microbubbles for localized real-time control of drug delivery using ultrasonography-guided magnetic targeting and ultrasound. The implication is the development of advanced, non-invasive drug delivery methods that can be precisely controlled, potentially improving the therapeutic outcomes of various treatments. 4 Reference 1412, Curtain et al. 2018. This reference presents the development of an oral once-weekly drug delivery system for HIV antiretroviral therapy. The implication is a significant advancement in patient compliance and convenience for long-term treatments, which can have broad applications beyond HIV therapy. 5 Reference 1422, Kang et al. 2018. This study discusses the design and synthesis of waterborne polyurethanes, which have implications for drug delivery materials. Waterborne polyurethanes can be used to create biocompatible drug delivery carriers and coatings for medical devices. 6 Reference 1433, Fenton et al. 2018. This review article discusses advances in biomaterials for drug delivery. The implication is that researchers are continually developing new biomaterials with improved properties for drug delivery applications, which can lead to more effective and targeted therapies. 7 Reference 1434, Tsung et al. 2018. This study presents the development of stabilized single-injection inactivated polio vaccine. The implication is the potential for improved vaccine delivery methods that can simplify vaccination programs and enhance global health efforts. 8 Reference 1440, Khan et al. 2019. This study discusses the delivery of endothelial siRNA in non-human primates using ionizable low molecular weight polymeric nanoparticles. The implication is the development of nanoparticle-based delivery systems for RNA therapeutics, which is a rapidly growing area of research. 9 Reference 1450, Verma et al. 2019. This reference presents an ingestible self-orienting system for oral delivery of macromolecules. The implication is the development of innovative drug delivery devices that can improve the oral delivery of biologics and other large molecules. 10 Reference 1466, Traverso et al. 2019. This study introduces an ingestible self-orienting system for oral delivery of macromolecules. The implication is the potential for transforming the way certain drugs are delivered, particularly for patients who require long-term treatments. These references collectively highlight the ongoing research and development efforts aimed at improving drug delivery methods, increasing patient compliance, and enhancing the therapeutic efficacy of various treatments. Advances in biomaterials, nanotechnology, and innovative drug delivery systems continue to shape the field of pharmaceutical sciences and medicine. References 1501 to 1561. The references provided cover a wide range of topics related to drug delivery and materials science. Based on these references, here are some of the main implications for drug delivery today. 1. Nanoparticle-based gene silencing. Reference 1502 discusses the use of nanoparticle-encapsulated siRNAs for gene silencing in the hematopoietic stem cell niche. This approach can have significant implications for the treatment of various diseases by targeting specific genes responsible for pathological conditions. 2. Brain interstitial fluid sampling. Reference 1503 presents a platform for microinvasive membrane-free biochemical sampling of brain interstitial fluid. This technology can provide valuable insights into brain health and disease and may facilitate the development of therapies for neurological disorders. 3. Drug delivery for traumatic brain injury. Reference 1508 discusses the delivery of siRNA in traumatic brain injury, aiming to overcome the blood-brain barrier, BBB, pathophysiology. This has implications for treating brain injuries and neurological diseases by delivering therapeutic agents directly to the brain. 4. Nanotechnology for infectious diseases. Reference 1509 highlights the role of nanotechnology in treating infectious diseases. Nanoparticles can be designed to deliver drugs or vaccines effectively, which is particularly relevant in the context of emerging infectious diseases like COVID-19. 5. Precision nanoparticles for drug discovery. Reference 1511 discusses the engineering of precision nanoparticles for drug discovery. This technology can accelerate drug development by delivering drug candidates to specific targets with high precision, reducing side effects and improving therapeutic outcomes. 6. Ingestible electronics for microstimulation. Reference 1506 introduces ingestible transiently anchoring electronics for microstimulation and conductive signaling. This technology has implications for personalized medicine and therapies involving precise electrical stimulation of specific areas of the gastrointestinal tract. 7. Exhaled aerosol analysis for COVID-19. Reference 1505 discusses the increase in exhaled aerosol in individuals with COVID-19. This research has implications for non-invasive diagnostics and monitoring of infectious diseases through breath analysis. 8. Nucleic acid delivery. References 1520 and 1540 focus on nucleic acid delivery for therapeutic applications. This includes mRNA delivery, which has gained prominence with the development of COVID-19 vaccines, and genome editing, opening new possibilities for precision medicine. 9. Mucus interaction in drug delivery. Reference 1537 explores mucus interaction to improve gastrointestinal retention and pharmacokinetics of orally administered nanodrug delivery systems. This is essential for enhancing the efficacy of oral drug delivery. 10. Microneedle vaccine printing. Reference 1551 introduces a microneedle vaccine printer for decentralized manufacturing of thermostable mRNA vaccines. This technology can revolutionize vaccine distribution and accessibility. 11. Immune stimulation with TLR agonists. Reference 1552 discusses the engineering of kinetics for toll-like receptor TLR, agonist release from prodrugs to enable tumor-focused immune stimulation. This has implications for cancer immunotherapy. 12. Humanized mouse models. Reference 1553 describes the identification of a humanized mouse model for testing immune-mediated biomaterial foreign body responses. Such models are crucial for developing biocompatible materials for drug delivery and implants. These references collectively highlight the ongoing advancements in drug delivery technologies, including the development of novel nanoparticles, improved delivery methods for nucleic acids, and innovations in biomaterials for medical applications. These advancements have the potential to revolutionize the treatment of various diseases and improve patient outcomes. Book main ideas. These book references cover a wide range of topics in the field of controlled release, drug delivery, biodegradable polymers, tissue engineering, and more. Here are 20 main ideas from these references. 1. Controlled release systems. The books by Langer and Wise discuss various aspects of controlled release systems, emphasizing their medical applications and classification. 2. Biodegradable polymers. Chasen and Langer's book explores the use of biodegradable polymers for drug delivery, highlighting their significance in the field. 3. Angiogenesis. Steiner, Weiss, and Langer delve into angiogenesis, which is the formation of new blood vessels, and its importance in medical applications. 4. Biopolymers. Peppers and Langer's works in advances in polymer science focus on biopolymers and their relevance in various biomedical applications. 5. Liposomes in immunology. Cohen and Langer discuss the concepts and applications of liposomes in immunology, demonstrating their role in drug delivery and vaccine development. 6. Proteins and peptides delivery. Cleland and Langer's book explores formulations and delivery methods for proteins and peptides, critical in the development of biopharmaceuticals. 7. Tissue engineering. Lanza, Chick, and Langer's textbook of tissue engineering introduces the field of tissue engineering and its principles. 8. Synthetic biodegradable polymers. Attila, Mooney, Vacanti, and Langer discuss synthetic biodegradable polymer scaffolds, which are essential in tissue engineering and regenerative medicine. 9. Principles of tissue engineering. The multiple editions of the Principles of Tissue Engineering by Lanza, Langer, Vacanti, and Attila provide comprehensive insights into tissue engineering techniques and applications. 10. Polymer science in biology and medicine. Terrell and Langer's book on polymer science highlights the significance of polymers in biological and medical contexts. 11. Microfluidic technologies. D. Murthy, Kadam Hosseini, Langer, and Blander's book discusses microfluidic technologies and their role in advancing human health, including diagnostics and drug discovery. 12. Recent advances. Lanza, Langer, Vacanti, and Attila's 5th edition of Principles of Tissue Engineering likely covers the latest advancements and breakthroughs in the field up to 2020. These books collectively provide a comprehensive overview of key topics in the intersection of materials science, medicine, and biotechnology, emphasizing controlled drug release, tissue engineering, and the use of polymers and microfluidics in medical applications.
Welcome to The New Chemist. We're glad you're listening. Feel free to download this podcast on Google Podcasts, Apple Podcasts, and Spotify. Here on The New Chemist, we discuss chemistry, which simply put is the science of change, as well as careers, community research, and COVID-19. We're happy you're tuning in. My guest today is the Dean of the College of Engineering at Georgia Tech, Dr. Rahim Bayer. Thanks for joining me today. It is good to hear from you. Just briefly, I'll inform my audience about you. Dr. Bayer is a Georgia Tech alumnus. He earned his master's and PhD in electrical and computer engineering from Georgia Tech in 1999 and 2003, respectively. He received his Bachelor of Science in Electrical Engineering from North Carolina Agricultural and Technical State University in 1998. A native Atlantan, he is a graduate of the Atlanta Public School System. Dr. Bayer also leads the Communications, Assurance, and Performance Group and is affiliated with the Institute for Information Security and Privacy. He is a co-founder and board chair of Fortified Logic, Incorporated, an industrial cybersecurity company. He serves as Institute Data Security Lead. He is a co-founder and steering committee member of the Academic and Research Leadership Network. He has held several additional leadership roles at Tech, including serving as interim Steve W. Chaddick Electrical and Computer Engineering School Chair during the 2017 to 2018 academic year, the Electrical and Computer Engineering Associate Chair for Strategic Initiatives and Innovation from 2016 to 2018, and Chair of the Electrical and Computer Engineering Computer Systems and Software Technical Interest Group from 2015 to 2017. He received the National Science Foundation Career Award in 2009 and was selected for the Defense Advanced Research Project Agency Computer Science Study Panel in 2010. He's a member of the American Association for the Advancement of Science, the American Society for Engineering Education, a lifetime member of the National Society of Black Engineers, a senior member of the Institute of Electrical and Electronics Engineers, and an Association for Computing Machinery Distinguished Sciences. Prior to becoming a faculty member at Georgia Tech, Dr. Bayer was an assistant professor in the Department of Computer Science at Georgia State University, a research engineer with electrical and computer engineering at Tech, and a consultant with Anderson Consulting, now Accenture. He has served as guest editor for a number of journals and magazines, including IEEE Network Magazine and IEEE Communications Magazine, and an associate editor of several journals in the field. Please welcome Dr. Bayer. Thanks, Dr. Bayer, for joining me. It's good to have you on. You are a very accomplished engineer. You're now Dean of the College of Engineering at Georgia Tech, which is a very good engineering school. So my question to you is, what have been your long-standing interests in the field of science?
Yeah, well, first, David, thank you for inviting me and taking the time to chat with me. That's a good question. I originally was drawn into the STEM field through video games many years ago. So I was a young kid, and my grandmother bought me an Atari 2600, and I tell folks that thing changed my life. I had lots of fun on that, and I had all the systems after that, and I would always see various points in the game, and let's say you see like a broken down vehicle, and I would like, man, it'd be really cool if we could drive this tank or fly this helicopter. And that got me thinking, well, what if I could change the game, and which ultimately is obviously computer programming. And so that kind of led me in the direction of computing. in high school, and ultimately decided to switch to electrical engineering. And by the time I finished my undergraduate degree, I was really fascinated by the whole concept of networking, computer networking. And so that has been what I've been focused on for the last couple of decades now.
Oh, wow.
As I finished my PhD, I really wanted to focus in on a specific area of networking, which was network security or cybersecurity.
Okay.
And so I ended up focusing on that. But you'll see that almost all my papers, even the standard cybersecurity papers, have this sort of networking flair to them.
Okay. So this is just a sidebar as we continue the conversation. Typically, I know for chemistry and biology, science and nature is like the pinnacle of journal publishing. What's the pinnacle like journal for publishing in cybersecurity? What would you say is the top journal?
Yeah, so there are actually 4 #1 conferences in cybersecurity, and it's not journals, it's conferences.
Okay.
But they're 15-page, 16-page conferences, right? So it's like dual column, so just like a long journal, and that's ACM, CCS, NDSS is the second one, IEEE Security and Privacy, known as Oakland, and then USNIC Security. So those 4 are the number. They're essentially tied for #1 in cybersecurity, and ideally you want to get something in those conferences as a graduate student and a faculty member.
Okay. Yeah. I didn't know that. So that's good information. So given all of the issues that COVID-19 has brought a lot of people, and also the challenges in academia, how do you maintain view of the bigger picture in your career and in your life in general?
Yeah, that's important to do. I've always been very interested in making a significant societal impact.
Okay.
And the way I look at the various roles that I've been in, they've been sort of the mechanism for me to do that.
Okay.
And the more I build my voice, as I went from a interim chair to a research vice president to now dean of engineering, the more I build my voice, the more likely it is I can have societal impact. And specifically, I'm very interested in expanding access. I want to make sure that the folks that come behind me and come behind you, if they're absolutely qualified, we got to make sure that they can get in the door at Georgia Tech and many other places. So that has kind of been innate for me. I've just seen the difference between those with resources and those that don't have them. And I know folks that are really, really bright and didn't have resources and just never had any good opportunities, and that bothers me. So that's always been sort of my true north, something that I've been focused on. And it's a lot easier for me to deal with and view the big picture. It's the sort of blocking and tackling things that like operational type things are not the things that I really enjoy doing. So it's usually easy for me in terms of big picture. It's focusing on the true north and what's really important. And for me, that's family and physical and mental health and all those things first. And then it's, okay, well, I have a job that I got to make sure I do this job well.
Okay, so what you said raises a lot of questions in terms of, you said you see the big picture. So what's your take on how do you pragmatically break it down? What's your first step? You don't have to go through the whole process, but how do you go from, okay, I want to expand access, to what do I need to do today, or what do I need to do this year?
Yeah, no, that's a good point. So what I mentioned also was that I needed to build my voice, right? Okay. So it's like the more significant of a voice you have, the more change that you can ultimately affect. And so part of that is actually being successful in my career, right? So if we ignore actually sort of mechanically trying to expand access and just look at building the voice, that essentially has been exceptional in my current career and continue to progress, right? Yeah. So that's one thing. So such that I can get to a point where I can, have a conversation, I can call somebody that's, extremely senior, like a Gary May, for example, or many other college presidents who are mentors and friends, and say, hey, I got this idea on about expanding access. So the first part is really building building the voice, so being exceptional at your current roles and progressing. But then there are other things that you can do that are kind of practical, right? So at Georgia Tech, we just, and this is done by our president, we just announced an APS pathway, so Atlanta Public School pathway. And what that means is if you apply to Georgia Tech and you don't get accepted in the first round, and by the way, we don't accept many amazing students because we just don't have room. So it doesn't mean that they're not quality, it just means that we just don't have room. But what that means is if you went to APS and went through APS and applied, didn't get accepted, you have up to 2 years if you meet certain requirements. Then you can essentially have an automatic acceptance coming back in as a transfer student a year or two later. So being involved in those programs, trying to amplify those programs. I'm actually an APS grad. So trying to be central in those programs is one way to do it. Another way to do it is looking at, we have these online programs. So we have an online master's in computer science, online master's in analytics, and online master's in cybersecurity. And I was the executive director that actually stood up the online master's in cybersecurity program. And that screams access because now there's no physical boundary. You can be all over the world. We literally have students all over the world. And also it's from a cost perspective, it's not unreasonable. And so it's $10,000 tuition for the whole master's degree, right? Not per class, not per semester, but per degree. And the third piece about that is expanding access is that you don't have to have a computer science or engineering undergraduate degree to get accepted into the master's program, right? So you can do these interesting programs that are much more accessible to people.
Okay, wow, that's good. Yeah, man, we leave our footsteps behind. And also, you said a lot of important things. Building your voice. So, how have you been adaptive and creative in the field of science?
Yeah, so it's funny. That's almost kind of natural for as you'll appreciate as you get out, and your advisor now also sort of like PhD level researchers. You will kind of naturally adapt in order to survive, right? Because what happens is problems shift, right? We're making progress with all sorts of things, and so for example, there's a hole in the sort of business / sociology type space, actually probably more like a HR type space. There's now this really important area called future work, which people never really they weren't focused on it pre-COVID, but now post-COVID or in the middle of COVID, hopefully in a few months or a little bit longer will be post-COVID.
Yeah, I hope
but now this is a big deal because people have found out, well, guess what? I don't have to be physically co-located with folks to work together, right? So even at Georgia Tech, we're conducting research, instruction, and our staff support. None of these things are co-located with each other, right? So you could almost have people all the way across the world, right? I mean, it doesn't matter at this point. And so the question is, well, how should the university of the future look? How should the workplace of the future look? Do we go back to do the exact same thing? And so my whole point is that because of this event, it's almost ushered in a new or amplified a previous research area. So people adapt and shift. And the same thing happens for technology. So over my career, I went from interested in networking to quality of service in networking to wireless networking to wireless network security, and then ultimately to cybersecurity. And finally, now my focus is on cyber physical system security. So it's sort of the integration of engineering and computing. And a lot of that just depended on my interests. It changed over time. Problems change over time, and also funding changes over time. So funding agencies, they decide, every year, what are the priorities, and you need to be aligned with those if you want to be funded.
I agree. So, just to drop a little plug for, you talked about expanding access, I think just to throw this idea out there, I think it would be good if students of Caribbean heritage could also eventually, because I think the evidence is there that in terms of discipline and work ethic, students from the Caribbean do have a good representation in that area. So it'd be good if schools such as Tech and others could eventually, hopefully in the next decade or two, start expanding access to those students as well. I think that would be I think that would be good, especially students of color from those areas. So,
I love to go and visit those places to do some boots on the ground discovery, right? Who doesn't want to go to the Caribbean? So
So even helping strengthen the research capacity would be good too.
Yeah.
So, how have you sought or found the right environment for you to thrive scientifically and intellectually?
Yeah, I kind of stumbled upon that. I think when I came out of undergrad, I only applied to one graduate program, which was Georgia Tech, and that was a mistake. I mean, fortunately, it worked out. But I always
it worked out well, I would say.
Yeah, but you never know, right? So I always encourage folks to listen. We want Georgia Tech to be your number one choice. We think we are the best out there, and we're the best for you. So certainly apply to us. But who knows what may happen, and apply to other places as well. And so I always wanted to come back to Atlanta, and I knew Georgia Tech was a very good school, and that was kind of how I made my decision. I never thought that I would be working at Georgia Tech. And when I got to Tech, certainly it was not perfect, but I had overall a very good experience. I had a PhD advisor who is, he just turned 80, 80-year-old white male now, and he was like a father to me, and just more supportive than I could have ever imagined. And so I kind of stumbled upon just really good people, good mentors, and good advisors that created an environment for me to thrive. And then once I saw that, hey, well, this is possible, and then I was much more intentional about, well, is this the place that I want to stay? Do they, are our values aligned? And that's really important for me. I'm not, I won't be at any organization where I don't feel that my values are aligned with that organization. It's just, life is too short for that. And honestly, I feel that it does. I mean, we have really good leadership, very interested in essentially all the things that I'm interested in. So to me, it's a treat to be where I am. But again, I stumbled on it, and then I realized this is a really good place to be.
Yeah, that's good. Yeah, so I'm sure there are very sundry PhD students who eventually like to work at a place like Georgia Tech. So I'll leave that one right there. What have been your most effective and impactful ideas to date? What would you say have been the most impactful ideas you have implemented, whether it be in network security, whether it be in your various roles in administration? What would you say has been your most impactful idea?
Yeah, I would go with let's go with one technical one and one sort of mentoring type. Yeah, we'll do that. So the technical one is I'm pretty much probably most known for work I've done in rogue access point detection, and so this is really early work, a couple of decades ago, literally, but it's
just a couple of decades.
Exactly. It's you got these wireless access points, and believe it or not, they were not as pervasive as they are now, right? And so you got to be basically rich to get one of these. Like companies would have to be really wealthy to have two of them, and you might have Wi-Fi in 10% of the building, right? And that's kind of what it was when I was in graduate school early on. And so there was this risk that kind of popped up, this threat of, well, what if an individual bought their own wireless access point, and plugged into the network? What happens? And now you basically are expanding the company's private network into, let's say, the parking lot, where you can have an attacker just sitting in their car, just monitoring traffic, trying to reach these malicious, reach various machines that are via malicious ways. So all that stuff was folks were worried about, and there had been some attacks, and so we ended up coming up with a really cool technique that before it was like, well, let's look, it's going to emit these wireless signals, these rogue devices. So let's kind of drive around, walk around, and see if we can detect these wireless devices. But that's crazy for like a campus, like a Georgia Tech type campus, or even companies that have these large campuses. So the method that I and colleagues developed, it focused on, well, if we look at the backbone traffic, because that's ultimately what they're trying to do. If you connect a wireless access point to a network, they're ultimately trying to traverse that network. So what we can do is monitor the traffic at the backbone, and we had some clever algorithms to determine that traffic originated from a wireless device and not a wired device. And then once we were able to do that, we can determine if that wireless device was a rogue or not, because we had a list of all the ones that were legit and able to determine that this was a rogue device. And so what's neat about it is now if you have a company that's massive, let's say like a Sandia, which is massive out of New Mexico, and this is again decades ago, we don't have to literally walk the halls. People would walk the halls with RF scanners looking for signals over half a mile, kind of square foot or whatever, half a mile radius, I guess you could argue, for these massive campuses. You can just look at the network traffic and determine that. So that's what I became when I became a distinguished scientist, the ACM distinguished scientist. Citation is for the work in rogue access point detection. We had one of the earliest papers in that world. And then the other thing I would say that I'm most proud of is me and two of my colleagues, Sam Graham and Bar Cola. Sam is the mechanical engineering chair and Bar is a professor of mechanical. We came up with the ARL network, so the Academic Research and Leadership Network. And the whole goal of this network was to develop a community for STEM PhDs and near PhDs, basically like you, because we noticed that just didn't really exist. And we wanted to make sure we had various type of mentoring programs and all that in place. Well, we started about 7-8 years ago. Fast forward, we have about 400 members now, and it's a very active network. We've had about 5 or 6. We have these workshops that they are co-located with NSBE, and we would pay to fly people up, maybe 30, 35 folks up to do like a 2-day intensive training on how to be successful in academia, how to do your dossier, how to interview, how to do all those other things. And so we've been doing that for about 5 or 6 years. So this is a community that didn't exist, and we actually were able to build it from scratch. So I'm pretty proud of that.
Oh, that's good. So I'm gonna be very upfront. One of my goals is actually working academic. So cool. I'm a professor. So is this available for outside students, or is this only a tech center?
No, it's certainly all students. So it's PhDs, so it's a research community. So it's PhDs or near PhDs. So it's just arlnetwork.org.
Okay.
You can sign up there.
Okay, cool. That's good. That's very good. Yeah. So yeah, I thought that's interesting. You said monitoring network traffic to determine, if I'm understanding what you said correctly, monitoring network traffic to determine the origins of where the interference is coming from. Is that what you're saying?
Well, to determine the origins of the traffic itself. And so can I look at the traffic and determine that it started on a wired network or a wireless network? It turns out you can, just because wireless networks are just a lot more stochastic, if you will, and they also have various protocols that actually leak over into the wired network. And if you can detect those protocols in the traffic, you can say, well, this had to have come from a wireless network.
Okay, so I have a question where that's concerned. You said wireless networks are somewhat stochastic. To what extent? Because I thought, is it because of artificial intelligence, or is it the capacity of it to self-generate or come up with new ways to formulate its structure?
No, I'm just talking about really its susceptibility to interference. You turn on a microwave and your SNR is gonna drop significantly, right? So you basically have this shared medium versus a wired network where it's not shared. And so if there's when you plug into the wall, there's no contention. It's just your device that can communicate on the network, and you're using a network switch. But if you're on a wireless network, there is going to be contention. You're going to be fighting with the other wireless devices that are there that are in your proximity. You're going to be fighting with microwaves and other RF interference. You're going to be fighting with lightning strikes and all that sort of stuff. So my point is, all that can affect the wireless network versus the wired network, and that plus the type of medium access protocol that wireless networks use allows you to distinguish between the two.
That's good. So how do you maintain, you have a lot of responsibilities and you have accomplished a lot of stuff. So how do you maintain balance, Dr. Bayer? How are you maintaining balance?
Yeah, balance is hard. People talk about work-life balance and I've heard other phrases of work-life integration. And What I try to do is make sure that I prioritize what are important, and that's family. You have to be very intentional about it. Oftentimes, I will have to work late. I got to work late tonight. I had to work late last night, and so I won't be able to spend as much time with my kids and family. But I just make sure that I prioritize things and know that it's going to be give and take. And if I really, can't spend time, these 2 days during the week, then I got to make sure I get it in with family and kids on the weekend, and just know that that balance is kind of hard. But you just got to make sure you prioritize. And even if you start out doing it, then it will just continue throughout your career. And so even if it's things that are important, you have to be willing to miss those things for your mental health and for your family's health.
Exactly.
I try to be very intentional about my meetings. Even now, do I go into work or do I work from home? And I'm intentional about those things to minimize the time that I'm away from my family. Or if I go in, this will be a good day for me to drop my son off so we can spend that time in the car. When I travel, I'm very intentional about the timing of things, right? So can I time it? If it's a DC trip, can I actually time it such that I can drop my kid off at the airport? Not at the airport, drop him off at school. I go to the airport and actually be home in time for dinner. Right. And so it just requires you thinking about it and being much more intentional and strategic. And then you can do it, but it's not easy. I have a good partner. My wife is very supportive, but she's equally busy. But the word really is being intentional, and you can pull it off.
Okay, that's good. That's something I'll note as well. Actually, I'll get there. I have, as we conclude, because I know you have a lot of things to do. So as we conclude, how have you been so successful as a pioneer in your field? What do you think has complemented your success? And what 2 pieces of advice would you give to those wanting to pursue the field that you're currently working in?
Yeah, so I've been fortunate. I think I have always been very, very hungry and just, and resilient, I think is a way to describe me. So I, had many setbacks sort of in life in general, and I've used that experience to apply it to my professional career. So I don't get as worked up as some folks do about certain challenges. I just find a way around it, and because I've been doing that my entire life. So being resilient, working very hard, and also finding mentors, being very intentional about finding mentors, and mentors that look like you, mentors that don't look like you. As I mentioned earlier, my advisor is more of a sponsor and a champion than even a mentor. He's a really good friend. And so you got to make sure you do that, and don't be afraid to ask questions. I ask questions all the time, including to the people that report to me. That's fine. I tell them, I don't care about being right. I just want to make the right decision. So, tell me if I'm wrong, that's fine, but I want to make sure that we get it right. It doesn't have to come from me.
Preaching.
Yeah. So, hey, the advice I have is really essentially that is work hard and get mentors. Don't be afraid to ask for help, ask for advice. It does not show any sort of weakness. We all struggle, even the most arrogant folks that don't want to show it. They all do. And it's much more important, I think, to get it right than to actually be right.
Yeah, that's true. That's good. Something to know. So what 2 pieces? So what has been the most beneficial advice you have received?
Oh man,
last question, right?
Yeah, it's actually what I talked about earlier. I mean, I get lots of advice, and oftentimes I internalize it. And it's funny. My wife and I were debating this, right? So a lot of times I get, and as engineers and scientists, we're taught to not memorize, right? We're taught to understand like how it works. Yeah, and it's funny. So she's a lawyer by training, and a lot of what they do is lots of complicated things, but also memorizing cases and exactly where things were found in the case. And we're taught to do the exact opposite, right? So she would be able to pull up, here are the 3 most important pieces of advice for me, and they came from A, B, C, and D. For me, I usually take that advice and I internalize and I incorporate it, and then I'll forget like man, did I get this advice from someone? Because I've just started to do those things.
Mm-hmm.
But one I often pull out, which obviously means that it was important and stuck with me, is the whole build your voice piece. And this was from one of my wife's law partners many years ago, and we were talking about, I think, diversity and just how to change the various fields of engineering, of law. And he basically said, well, if you can't do anything, it's very difficult to make these changes kind of at the bottom. And what you got to do is build your voice and be exceptional. And then once you do that, then the changes that you attempt to make, they'll be so much more impactful. Mm-hmm. And so I love to sort of leave that with you and your audience, and it certainly has worked for me.
Yes, thank you again, Dr. Bayer. It was good to have you on.
Yeah.
Thanks for listening. We're glad you were able to tune into this podcast. Once again, this is The New Chemist, where we discuss chemistry, which simply put is the science of change, as well as the other sciences, careers, community, research, and COVID-19. Thanks again for listening. Note, the views on this podcast represent those of my guests and I. Welcome to the New Chemist podcast. We're so glad you're listening. Feel free to download this podcast on Spotify, Google Podcasts, Apple Podcasts, Odyssey, Stitcher, and a variety of other platforms. Here on the New Chemist, we discuss chemistry, which simply put is the science of change, as well as other sciences, careers, community, research, and other lectures in chemistry, and we analyze those lectures as well. My guest today is Dr. Campo. It is so good to have him as a guest today. He is the Associate Vice President and Head of Small Molecule Research and Development at Merck, a very established and accomplished scientist, having received numerous citations, patents, and multiple awards. He is currently a fellow of the Royal Society of Canada. It's definitely a treat and an honor to have him as a guest today. Okay, so Dr. Campo, let's begin. What have been your long-standing interests in the field of science?
So, ever since I was a young kid, I was interested in sort of how things work. Asking tons of questions, trying to understand how the world works. I was also always interested in building things. I was one of those, obsessed with Lego kids. Oh, yeah. And in high school, I became really interested in sort of the biochemistry through one of my biology teachers, who was sort of explaining how cells work and ultimately the chemistry of cells. And I became, or at least at the time, I thought I was really interested in biology, and I decided to pursue undergraduate studies in biopharmaceutical sciences. But I would say that I probably didn't realize that what I really liked about that high school biology class was actually the organic chemistry part of it. And I realized this when I was a second year undergraduate student, in organic chemistry in a class taught by Professor Louis Berriot at the University of Ottawa. And he really ignited something within me in terms of my interest in organic chemistry and the chemistry of carbon and sort of how you stitch these molecules together. And sort of started to introduce the concept of how these molecules could have an impact on the world. And ultimately, I decided to pursue graduate studies in large part because of my interest in organic chemistry. And I did a PhD in catalysis, where I studied how late transition metals can catalyze reactions that would otherwise be impossible, and the chemistry of palladium. And through that work, I became interested in sort of mechanistic understanding and the details of how reactions work. And ultimately, what happened was I realized that, through an acquaintance of mine, someone in my network, learned, what process chemists do, and found that it was a phenomenal way to apply my strengths and things that I was really interested in to a problem that could have a really big impact on the world, and ultimately decided to join Merck as a process chemist a little over 15 years ago.
Okay, yeah. So how do you maintain vision and teamwork in your environment and your work environment at Merck as you work on these research projects? How are you maintaining the big ideas, the big picture ideals of vision and teamwork? How do you maintain those?
So one of the things that I've always found was really important is to link our work to the purpose that it is we're trying to accomplish. And I think we have sort of such a privileged position, as scientists in pharma, to be able to link the work that we do to ultimately improving human health. Like, we're literally changing the world one reaction at a time. And
that's cool. That's cool.
and there aren't a lot of necessarily jobs out there where you can directly link what you do to a purpose. And I think that's a really important thing that I try to reinforce with my team. But I also think it's important to have broad interests. And so I think as scientists, it's really easy to get into this tiny little uber specific area of expertise, which is how the world works for science. But I've always thought it's really important to have broad interests. And I think for pharmaceutical development, again, because there are so many disciplines that have to come to bear to bring a drug to market, that's another way for me to sort of think about the bigger picture, is understanding what the biologists are doing and understanding what the chemical engineers in my team are doing, or understanding how medicinal chemists design molecules, and ultimately how our manufacturing colleagues are going to have to utilize the chemistry that we put in place, and our drug product colleagues that have to formulate the drug. So it's a tremendous privilege, I would say, for us to have that purpose, but also to have that opportunity to get that really broad set of stakeholders. And the last thing I'll say is, because we're still doing cutting edge chemistry, we're very well connected and continue to contribute to the academic community as well. And that's another way to sort of broaden your interests and get the big picture.
Okay, wow, that's good. That's good. So what if you were advising or giving suggestions to someone who wanted to work in the same role that you're working in, as someone who deals with small molecule research and development, what would you say would be the toolkit or the degree that would give you the best chance of getting an opportunity to work at Merck?
So I think there's so many disciplines at Merck that contribute to developing small molecules, not to mention all the biologics and vaccines that we develop as well, that I think there isn't like a single discipline or a single degree. Specifically for my career path and being a process chemist, advanced degree in synthetic organic chemistry was definitely a good way for me to get entry into the field. We hire a lot of chemists that we hire to solve really difficult problems. Most of them have graduate degrees, PhDs or masters. But we also hire chemical engineers. We hire analytical scientists. Some of our specialty groups have other disciplines like protein engineers or people who have experience in other types of engineering. So it's pretty broad. The biggest impact or I guess biggest opportunity to come to a place like Merck is really to leverage the network that you build throughout your studies, right? Whether it's through your undergraduate institution or through a graduate advisor, and really get to know people that work in the area that you're interested in. And then you'll really know what it's like to work there. And first, you'll know if it's a good fit for you, but that second, that can open doors to get the opportunity to interview.
Okay, yeah, that's good. That's good. So what would you say has been your most creative piece of work in the field of science, specifically on what you work on? And you can be as technical or as simple as you want to be. What would you say has been your most creative piece of work? Is it an elegant bond disconnection? Or,
yeah, I would say, the longer you are in the job that I am, the less close to the science you are. But if I go all the way back, so what I would say is there's maybe a couple things. So maybe I'll split it by my graduate work versus my work at Merck. So when I was a graduate student, I had an insight that a certain type of electronic effect in the molecules that I was studying could be exploited to make a carbon-carbon bond that hadn't been known before. And that seed of an idea eventually became what we now call concerted metallation deprotonation, which is a well-accepted mechanism in palladium catalyzed direct arylation reactions. And it was, I was 24 years old. I had this idea that, CH acidity was going to be an important factor in these reactions, and that electron deficient arenes should work, which was not known at the time. And ultimately that ended up working, and my whole PhD ended up being about that. And I'm really proud of that work. I would say if I have to pick one thing that I'm the most proud of at Merck so far, there are two projects on which I made really important contributions. One of them is doravirine, which is an approved drug for HIV treatment, where I was able to design a synthesis of that molecule to really rapidly and quickly bring it into preclinical and clinical studies, and ultimately that drug was approved, and so I'm really proud of that. And then more recently, I actually led a cross-functional team that developed a cardiovascular drug that isn't on the market yet, so I can't really talk about it, but it was a cholesterol medication that's now going into phase 3 at Merck, and it was one of the first macrocyclic peptides that Merck synthesized and ultimately brought to market. And our team had to develop a bunch of extremely novel chemistry in order to be able to do that. So I can't wait to be able to tell the world about that in a couple of years.
Okay, that sounds really good. It's interesting that you worked on a HIV drug. You said an HIV drug. Yeah, yep. yeah. That's interesting because one of my mentors, I don't know if you're familiar with the name Lou Jungheim. Mm-hmm. Yeah, who worked on Nalpinavir. Yeah. Okay. Yeah. So nice. Yeah, it's definitely interesting. It's an interesting connection, interesting conversation. So small world in a way. So how have you sought or found the right environment for you to thrive scientifically and intellectually? How did you go about finding Merck, or did Merck find you? What process did you use to find this job or find this role or progress in your career? So
I think I would be kidding myself if I didn't think there's a tremendous amount of luck that goes into these types of things, right? So
serendipity.
I was a undergrad at the University of Ottawa. I didn't really know exactly what I wanted to do long term, but I knew that I really loved organic chemistry and that I wanted to do something there. A friend of mine who was sort of my lab partner was like, hey, I'm going to go to grad school and I'm going to work with this guy, Keith Fanyu. He just started like this month. He's a brand new prof, but he's really cool and I want to work with him. So I went to meet with Keith and I said, hey, I think I want to go to grad school too. Like I hadn't really thought this through yet. And we talked for about an hour and there's like a spark, like you meet these people and you're just like, wow, this person's awesome. I want to just spend time with this person. It's going to be great. So, he didn't have a lab. He didn't have, I didn't know anything about him. He was a tremendously successful graduate student, but at the time I wasn't in the know, right? So I joined this guy's lab and it ended up being, maybe the best 4 years professionally. It was just an amazing experience to work with him as a mentor. And through him, I learned a lot about pharmaceutical science and sort of the different places that people do process chemistry and med chem and what's the difference. And one of his close friends was a process chemist at Merck, and he would invite him every year to come and speak at the university and speak to the group. And so this guy, Greg Hughes, used to come and give these scientific talks, like this is what we do and this is the impact that we have. And I was always tremendously inspired by that. And I met him and we eventually built a relationship. And so, 4 years later or 3.5 years later, when there was a position at Merck, he actually called and said, hey, there's a position, you should apply for it so that we can interview you and see if you're a good fit to come here. So, if you think about that progression that I just walked you through, I didn't talk about my accomplishments. I didn't talk about, obviously you got to deliver the science, but if I hadn't been in Keith's lab and if Keith's best friend hadn't been a process chemist at Merck, I doubt that I would have had the opportunity to interview. And I think sometimes we just have to lean into that, chance matters. And so that's why you need to know as many people as possible. You need to kind of cultivate that network because I think it's really important. But then once you interview, I always tell people when you interview at a place, you're interviewing them as much as they're interviewing you.
I agree.
You become the people that you work with. And so when you're interviewing there, if you meet people that you're like, wow, I hope one day I can do what that person does, then that's a great fit. And that's how I felt when I interviewed at Merck. I knew that I wanted to be a process chemist at Merck as soon as I met the people that worked there, the way that they thought about problems, the way they were really passionate about the impact they could have. And that has been true. And it's been true for the last 15 years, which is why I'm still here.
Wow. That's good. That is good. Wow. That's good. So, what would you say is complemented to your success so far? Yes, you said there's a degree of serendipity or chance or whatever you want to phrase it. who would you say has been one of your driving encouragers, motivators, source of inspiration? What would you say has contributed to your success? Can you name some of the people or talk about the people who really played a role outside of the ones you mentioned already?
Sure. Yeah, I mean, I would say I like sort of your line of questioning here. Like, I think the people really matter. I think your mindset matters a lot as well. So I've always been fascinated by ideas. I'm sort of creative by nature. I'm excited by new ideas and the prospect of doing something new. Okay. And I have probably more of an optimistic bend than a pessimistic bend. And scientists who are listening to this will know, like, you bring a new idea to someone and one person will say, well, that's definitely not going to work. You shouldn't do that. And then another person will say, wow, that's really cool. You should try that, And I've surrounded myself with people that are more on that side of the spectrum, people that are going to cheer you on when you have a cool idea that you want to try. And I would say, I already talked about Keith and about Greg, but when I was at Frost, one of my first mentors there was a guy named Stefan Willett and a woman called Sarah Dolman, and they had been there 3 or 4 years, so they kind of knew the ropes, but they were really good at sort of encouraging me to try my ideas. I had a peer that just started at the time, this guy named Ernest Lee, who's now at Gilead. And I remember going into his office with a crazy idea and I drew it on the board and I was like, do you think this is going to work? Because nobody else thinks it's going to work. He's like, that's the coolest thing ever. You should try it. And then I went and I tried it and it worked. And it was like, if he'd have said no, he'd have been like the 5th person to tell me no. And then I probably would have said, okay, I'm not going to try this. And Keith used to say, you have to think of an idea long enough to convince yourself to try it, but not too long to convince yourself that it won't work. And I think that that's tremendous advice. I've had other mentors like that. When I first moved to the US, I worked very closely with a mentor of mine who's still my boss, Kevin Campos, who was the same way. I have a peer right now, another associate vice president, Becky Ruck, and I, that I've worked together for over 10 years, and she's like that too. So there's kind of this element of people that surround you that sort of ultimately make you better. And that's the only advice I'll leave you for this question is, I feel like I've thought a lot about how I can make others around me better. And ultimately that makes me better too. And then we're all better for it. And I think that's really important.
Yeah, I agree. You bring value to the space that you're in. And that value, it adds to you and to others as well. Yeah, that's good. So how do you maintain a balanced life given all your responsibilities and accomplishments? Or let's phrase it differently. How do you maintain your priorities? How do you keep your priorities in check? How is your work-life integration? How do you maintain a sense of resilience when you face obstacles? We could phrase this, spin this question in different ways.
No, I like what you said. I like what you said. Work-life integration or work-life fit. I don't believe in work-life balance. I think balance implies that some of it is bad and some of it is good. Fit is about making sure that you get the most out of how you spend your time, regardless of whether that's work or not work.
Yeah.
What I would say is, this evolves over time, and as your responsibilities increase, this becomes more and more challenging. One of the things that I always tell people in my group is you have to have very clear boundaries for certain things. And for me, like, I'll give you an example. Really early on, when I had a very small family, when my wife and I first got together, and ultimately when we had our son, having dinner together every night was really important. And so there was never going to be a time where I would stay late at the lab just because I could and skip dinner or miss dinner with my family. And so, I'm the kind of person that leaves work so that I can get home and have dinner with my family. It doesn't mean that sometimes I don't get back on my computer later, or, when I was a graduate student, I'd go back to the lab after dinner. But that was sort of one of the imperative things that I wanted to do. And of course, things get in the way of that, like travel and whatever. But, it was one of those things. And I think over time, I got really good at figuring out what were those things that were really important to me, either because they brought me strength, they brought me joy, they helped me, sustain my passion. And those could be things that are within work as well. So I always tell people, find those things at work that you're really good at and that bring you a lot of energy, and make sure you do a little bit of that every day, because you could have a day filled with stuff that you're really not interested in for whatever reason that particular day, or it's a task that you're not particularly excited. But if you can find an hour or two in that day where you're going to do something that you're really passionate about, that you're really excited about, that's what's ultimately sustain you over time. And then you just got to be ruthless with your prioritization. And so you have to weed out the things that really don't drive a value proposition for you, whether that's a professional value proposition or a personal value proposition, you know? And I would say that, again, I always tell people in my team, like, you're going to be asked to spend time on all kinds of things. And when people ask, they don't necessarily have the complete picture of what your day looks like or what your life looks like. And it's okay to say no, right? So spend the time on things that you're really good at and that drive a value proposition for whatever it is you're doing at that time, whether that's a company or whether that's your home life. And then be ruthless in your prioritization and just start cutting things out to create space for that. And I would say that that's been tremendously successful for me. I'm actually able to get more done in less time because I don't spend time on things that don't necessarily drive a lot of value, you know? Yeah. And that's really important.
Yeah, that's very good. And that's the same reason why I enjoy podcasting so much and enjoy having these conversations, as well as assisting with science education in the community that I serve in and serving as faculty. Yeah, I completely agree with you. You summed it up well. So you also have a podcast, Farm to Table Podcast.
Yes.
So my question to you is, what led to you starting that? What has been how do you find time for all of this, Dr. Campbell? You have a family, you have a high-ranking job that's has a lot of responsibilities, and you also have a podcast as well to put the icing on the cake. So how are you able to do all of this? So tell us.
This is actually a great segue, David, because we were just talking about, like, find the things in your life that bring you joy and dedicate time to it, right? And one of my strengths is communication. Like, I get a lot of energy out of meeting new people, out of talking about stuff with people. Like, if I have a day full of meetings where I'm meeting people one-on-one, I'll be really energized at the end of the day. Whereas if I have a day where I have to sit in my office and work on a document for 5 or 6 hours straight, or write a paper, or like I'm not interfacing with people, I'm completely drained of energy. And I realized this somewhere about 10 years ago. I sort of did a Clifton Strengths Finder assessment, and communication was number one. And I was like, oh, this is kind of interesting. And I realized that some of our strengths are also needs. Right? So if you're really good at something, you probably need some of that in your life. And so I started thinking about ways that I could apply my strengths to things that would drive value for our company, right? And for my job. So one of those things was, well, okay, we have this audience, right, that we speak to at conferences, when we visit schools, that ultimately ends up being the recruiting pool for our talent, right? Graduate students at universities. But there's an infinite number of universities and an infinite number of graduate students. We can't reach them all. And in 2019, I was at a conference, and there was a speaker there, Randy Zuckerberg, who's actually Mark Zuckerberg's sister. And she's a marketing expert. And she says, like, you know, podcasting has really taken off in the last few years, but there's this sort of gap for subject matter expert podcasts. For, like, you know, if you're an organic synthetic chemist and you want to talk about organic synthetic chemistry, there's probably not a lot of podcasts about that. And I sort of had that on the back of my mind, like, hey, maybe we could do that. It would play to my strengths. It could allow us to reach an audience. And then the pandemic happened, right? And then we all got sent home. We had a bunch of interns that were coming for the summer, which usually would work in our laboratories, but we weren't going to be able to do that during the pandemic. And so one of the ideas we had was to start a podcast and work with an intern to sort of pilot what that would look like and have them do some of the editing and sort of lead the effort. But, you know, I would be the host, and started reading about podcasting and sort of decided that having a co-host in my case was going to be the right fit for me. And so I approached Danny Schultz, who's a member of my team, and I was like, hey, you know, I love talking to you all the time. We always have great conversations. Why don't we record them? And that could be a podcast. Yeah. And so we started messing around with that in 2020, and we weren't good at it at first. Like, we sort of, you have the growing pains. The growing pains, right? Yeah. But the general idea of that podcast is we pick a paper, usually a recent paper that our team has published, and we sit down with the key, either one or two of the scientists that contributed to that paper, and we try to get to the stories behind the paper, like, why did you do this work, and what are how does it link to what we do, and why is it important? Because when you read a paper, some of that stuff isn't necessarily written in there. So it's a cool way for, let's say, a graduate student to learn a little bit more about how we work. It's a great way for them to learn about the people that are in our organization that they may otherwise not get to meet or hear about. And so we launched summer 2021, so about a year after we started messing around with this as a side project. And then I think we found kind of our cadence. So like you do here, we have somewhat of a structure of, that we help people with preparing. We usually use a slide deck. And so, 4 or 5 slides just to kind of help anchor everyone. And then we tend to record in blocks. So we'll schedule, let's say 4 or 5, episodes worth of guests in a morning, and we'll do it all in one shot. And then we spend the next 3 or 4 months working on the editing and the production to get it out the door. So if you think about it, we usually have about 10 to 12 episodes a year. And so that's basically 3 half days worth of recording. And then after that, it's just sort of the, a few hours here and there to get everything buttoned up and launched. And so it ends up being not like a ton of work, but it is extra work. It's not like something I got to do for my job. We just decided to do it. But it ended up driving tremendous value. Like pretty much everybody who comes and interviews at Merck now says, hey, I heard the podcast and I learned about this paper that I probably wouldn't have learned about any other way. So it ended up being exactly what we wanted. But this all started from a place where I was like, I'm a really good communicator. I like talking to people. And if I could apply those skills to something that would drive value for my organization, that would be great. And then the pandemic happened and the intern thing lined up and we just did it. So it's an example of sort of my philosophy in action, if you will.
Yeah, I completely agree. And same thing with me. Like my podcast started in August 2020.
Here you go.
Right? Yeah, right when the pandemic started. It's amazing how the pandemic spurred creativity for many people. And then also I had the opportunity to interview people like the co-founder of Moderna, like professors at Harvard, the Broad Institute, like a variety of people, Dr. Campo, by the way. So I've had a lot of opportunity to meet people and engage in meaningful dialogue, and the whole basis and structure of the podcast came from a book, Find Your Path, which is published by MIT Press, in terms of me reading through that and adopting the same method of inquiry for the podcast. So as we conclude, what advice would you give to those wanting to pursue the field you're currently working in? What would you tell someone if they came to you and said, I want to do what you're doing in the next 15 years, or I want to help the world in a similar way in the next 15 years? How should I start? What would you tell an undergrad? What would you tell a grad student? So I think I would encourage undergrads to make sure that they have a passion for the science, because being a graduate student is difficult. Right? There's a ton of failure, and sometimes you wonder, why did I decide to do this? It seems like I'm working a lot and I'm not making a lot of progress. But being a graduate student is all about overcoming that, right? It's about learning how to solve problems and realizing that you don't go from point A to point B directly, that sometimes you have to take massive detours, and you have to be curious about the world and you have to be curious about your science. And if you feel like you have that, then you should go to grad school. If you want to go to grad school just to get a job later, but you're not sure you're going to enjoy the process of struggling through the science, that doesn't set you up for success. So it needs to start from a place of genuine interest in wanting to understand some problem, some scientific problem, and then you go to grad school. I agree.
And then the vast majority of pharma scientists, have some sort of graduate degree, and most, at least in the chemistry groups, have PhDs. And then I think if you really want to take the next step into a pharma career in chemistry, then that really comes down to developing the network while you're in grad school. So many schools will have pharmaceutical scientists that visit on a regular basis, meeting those people, telling them about your accomplishments and your science, so that when and if there's a job opening, you're sort of on their list of people they would want to interview. Because the hard part is getting the interview. After that, it's all on you. You know what I mean? It's all about your accomplishments and how you're going to make others around you better, and what you're going to bring to that organization. But there's, again, an infinite number of people and an infinite number of locations. And so finding the right people to bring in for an interview can sometimes be challenging. But I always tell people, when I was a graduate student, Greg Hughes is one of my mentors. He was visiting, and someone was like, well, what do I got to do as a graduate student to get a job at Merck? And he replied, well, you just got to be awesome, which I thought was a really funny question. But his point was that when you interview, you're going to have to convince a group of people that you're the kind of person that's going to solve the most challenging problems that this company has on the table. And so we look for people that are great at solving problems. It's not like we look for sub-disciplines of expertise. Like that happens every once in a while, but generally speaking, scientists are extremely adaptable. And so if you're really good at learning something new and applying it in a way to solve problems, when you come here, we're going to teach you a bunch of new stuff and you're going to solve a bunch of problems. And so that's what I tell people they need to be able to demonstrate in their interviews.
Okay, wow, that's good. It sounds like you are definitely moving forward and making lots of progress. And in my opinion, achieving your lambda marks. So reaching that point where you can transition from one energy state to another or one level to another and make an impact or gain the maximum from your environment. Yes, that is what I would say. So what has been some of the most beneficial advice you have received, either from your parents or professors or family members or significant other? What would you say something that replays in your mind when you like really succeed and do tremendous and brings you back down in terms of humility? So or really helps you to pick yourself up on those rough days.
Yeah, I feel like I don't know if you want to put this in the category of advice, but I had a French literature teacher when I was in high school. We were reading this really old piece of French literature, and he was really excited about this one passage. And the passage went in French, à vaincre sans péril, on triomphe sans gloire, which basically means like to be victorious without peril is to triumph without glory. And for whatever reason, so here I am, 16, 17 years old, I hear this for the first time. But this idea that, when you succeed, you're going to look back on those tough moments and realize that having overcome that will only augment what you ultimately accomplished. That sense, that one line, which is like from 16th century French literature, was really like, it makes the tough times easier to get through, because you're sort of like, yeah, it's really tough right now. I'm trying to solve this problem and I don't know if I can solve it. But when I solve it, this is going to be so much greater. And I used to walk around the labs when I was a grad student and walk around the labs at Merck. And I used to tell people this quote, like when they were like struggling with something. And I'm like, when you solve this problem, this is going to be even greater, right? Because you'll have overcome this adversity. And it reminds me of a quote that I recently heard in a movie about the guy who invented the Lamborghini. And he says, it isn't impossible until we fail. And if we fail, we'll fail searching for greatness. So it's kind of this similar vein of like, I just assume that we're going to get to the right place at the end. And that mindset is really important. It's important for scientists because most experiments that we run will fail, right?
Yes.
But ultimately, as a collective, as a group of scientists that come together to solve these problems in drug discovery and development, we often succeed in the end as a group, right? Yeah. So I think that's probably, it's not really advice because it came from like a book. I already told you about Keith's quote about not convincing yourself not to do stuff. That's something I repeat all the time as well. Yeah. But to me, those two things are probably the most important things that I think people should take away from this conversation.
Yeah, I completely agree. I remember this book, Good Timber, as we conclude. Remember this quote from Good Timber, this poem. It said, the tree that never had to fight for sun and sky and air and light, but stood out in the open plain and always got its share of rain, never became a forest king, but lived and died a scrubby thing. The man who never had to toil to gain in farmer's patch of soil, who never had to win his share of sun and sky and light and air, never became a manly man, but lived and died as he began. Good timber does not grow in ease. The stronger winds, the stronger trees. The further the sky, the greater the length. The more the storm, the more the strength. By sun and cold, by rain and snow, in tree and men, good timbers grow. So Dr. Campo. Yeah. I said that in high school and it still replays in my mind. Yeah, as well as my faith perspective and faith tradition. But yeah, Dr. Campo, it's so good to have you as a guest. It was a privilege and an honor.
Thanks for listening to the podcast series, The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free We are so glad that you were able to tune in today. Note: the views on the podcast represent those of my guest, and I take care and all the best.